guy told me that half of the heart is not working.
Yes.
I stood up and all of a sudden I felt I was drowning.
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That's where I do have the pain.
When was the last time that you had sex?
It's a month ago.
Was it with a regular partner?
2 people besides this girl, but they're all regular.
Oh God, getting pain, getting worse and worse and worse. I can't understand it no more. I can't even sleep.
Good morning, surgery. Good morning, St John's. Can I help you?
Could you come for this morning, 9:20?
Your breathing seems a bit better.
It is.
Good.
So I've had a few days where I've gone and not had any cigarettes, but then there's been other times where the craving's just been like so much that I've had one, but after a couple of, just took a couple of pulls and thought it's disgusting and kind of just got it out of my system.
Where are you getting the cigarettes from to have the odd one?
Well, it just happens to be a drawer.
Right. Which I'd like you to go home today and have a ceremonial emptying into the bin.
That's the fear bit, because I'm thinking, what if I really, really do need one?
If you were addicted to heroin, would I say to you, go and just put 5 ounces of crack heroin or whatever in your drawer just in case you need it? Would I say that to you?
No.
So why would I say that to you with cigarettes?
You wouldn't.
No, you wouldn't, would you?
I'm saying it to myself.
Again, it's another thing. You're setting yourself up to fail.
Okay.
So get in there and be positive.
I will do. Promise you.
Right.
I'll go home and get rid of it.
Get rid of it.
What's the date of birth?
8/10/35. No, just 60, sorry. 8/10.
Can you bend forward and touch your toes for me? Right.
Ow!
And up.
Sharp pain. It's like every time I move, it's stabbing me.
How severe would you score it on a scale of 1 to 10?
I would say 9.5.
How much movement have you got in this arm at the moment?
I have movements in it. Ouch.
Hello, sir. Good afternoon. Go on in. How's 2014 been treating you so far?
Well, in December I spent 16 days in Lewisham Hospital
Very sorry.
and now I'm on oxygen,
You're on oxygen at home now, are you?
16 hours a day.
So how are you finding that?
Oh, there's been lots of funny things happen. Your nose runs. Initially it was bleeding, my throat's gone. No, it was not very funny, really.
No.
Not at all.
It's not a nice thing to happen.
What shocked me was they said I had pneumonia.
Well, yes.
And I'd come down with a cough, and I had pneumonia and a heart attack. But it was the breathing bit that got me, because I don't know what it's like to drown, but by golly, that was the impression I got on that Friday morning.
Yes.
I stood up, and all of a sudden I felt I was drowning because I was trying to grab air, and my hands were going, trying to. It's frightening.
I think my biggest frustration is feeling that I can't help my patient because their problem is too complex. The key thing that we do is we listen and we try to understand what problems that the patient is coming to us with, and we try to work with them to try and find the best solution.
The guy told me that half of the heart is not working. And it's not Being able to pump the blood round so it's, the lungs are not functioning properly to do the job.
Well, look, put the jacket on. Let's have a listen to your chest and see what's happened. See what's going on. Deep breaths in and out for me, Brian. Good. Turn around for me. Let's have a listen at the back as well. Okay, deep breaths in and out. Good. Have a seat for me. Your chest sounds good. It sounds clear. You're getting lots of air in there, and so that sort of ties in. You can breathe. You're not feeling short of breath. That's all very positive. I imagine that the cause of a cough is the oxygen. It's drying things out and making you more likely to cough. I think the heart failure nurse is the right person to ask about getting reassessed to see if it's really needed or not, because it sounds like it may not necessarily be needed.
God, it's been a long 6 months, and I'm quite honest with you, it did bring me down.
Yeah.
And no one seemed to care anymore. I still don't, but what the hell?
Oh.
Anyway, doctor.
All right, Brian. Nice to see you. Take care. If you're having problems, call me, yeah? You don't have to always come down. Just give us a call.
You take care, mate. Bye-bye.
Bye-bye.
Make sure you're doing enough weight-bearing exercise, walking,
yes,
skipping, running, whatever you want to do that's weight-bearing.
The symptoms are classic of asthma. Nocturnal wheeze, chest tightness.
It's positive. You're pregnant, my dear.
We're talking about signs of serious infection. Drowsy, dopey, can't wake her, or the opposite. Hey, what's that? What can I do for you today?
For the past week or so, I've been getting really bad headaches. And then it kind of started to get worse Monday when I started to get migraines.
So when you say it started as a headache and then became migraine, what do you mean by migraine?
Migraine as in severe pain either at the front or the side of my head, and I usually always end up throwing up.
Is it a constant headache or is it coming and going?
It's a constant one. It's been constant since Monday.
At its worst, what sort of state does it reduce you to? Are you having to get into bed and...
Yeah, literally, I will be in bed with the duvet over my head.
Okay, and any other symptoms like cough, runny nose, diarrhea?
Diarrhea, yeah.
You had a bit of loose stool as well?
Yeah.
Okay. One more question. Is there any chance you could be pregnant?
Morning surgery, Stacey speaking. How can I help?
I have to see a doctor tonight.
Yeah, I will ask the doctor, but you are 35 minutes late and you may have to rebook.
When was the first day of your last period?
It was the middle of last month.
So that would make you a little bit late, maybe? Do you often miss periods?
Yeah, because of my pill.
Oh, right, okay.
Yeah.
And are you pretty good at taking it at the same time every day?
Yeah.
You don't forget? No. Just to be on the safe side, I think it's worth doing a pregnancy test. Do you think you could pee for me?
Yeah.
All right, if you take that to the loo and then just come on back straight to my room.
Hello, good morning, surgery. Can I help you?
Seems to be very busy at the moment.
I can see that.
Come in. I think what I'll do is send your urine off. There's just a little trace of white cell, which, you know, in the absence of any definitive diagnosis, and especially you're a bit tender over your bladder, we'll send that off to make sure there's no infection. But it's difficult to say whether the headache is causing the nausea or whether all the diarrhea and nausea is causing the headache. Yeah. What we can do is maybe give you some anti-sickness tablets, see if we can set things down, give you some painkillers, and then see how you get on.
Okay.
Pregnancy test is negative.
Don't need a kid yet.
Good morning, St John's Medical Centre. How can I help?
No, as I've explained to you, and I'll explain it again, there is no appointments with Dr Vash till Wednesday.
You're breaking up. I can't really hear you. I'm getting an odd word here and there.
I can't hear you properly, sir.
Do you know what? I can't hear you at all, I'm afraid. It's a very bad line.
You can have 3:40 or 4:20 this afternoon with Dr. Nav. Would you like that appointment?
I'm Dr. Parker. What's the matter with you?
I fell quite badly and I hit my knee, my leg and my ankle. And after, well, it was a bit painful, of course, for the week. But then when I woke up Sunday morning, there was like a blood effusion inside the knee, so it was like all black. I couldn't be sure that if it was
So
because
you fell on the ground?
Yes. And then there was some gentleman kicking me. And I can't be sure if that was because of the fall or the other person.
Your head wasn't injured?
I had a slightly kick as well on my head.
You weren't knocked out?
No. And ankle as well is still a bit blank, and I think it's still swollen.
Shall we have a look at them, I think?
Sure.
Does your job involve walking or standing?
Yeah, I'm a waiter.
Yes. That is...
I've been working all week and I've been walking. The walking is not really a problem, standing.
It is, yes.
It's
good.
not.
OK, let's pop you up on top here and have a look. One of the things that you ought to do straight away is put some ice on, because it stops the bruising, it stops the damage to the knee. And now I'm going to ask you to take your trousers off. That's a pretty colour, isn't it? My goodness. I'm sorry if my hands are a bit cold. Fortunately, I think there's no fluid in the knee joint at the moment. If I move round here, is that hurt? And what about the back? Is that all right? No. Now, I'm going to take it like that and I'm going to twist it. OK, now, I'm going to just pull on your leg. And I'm just going to push.
It's okay.
Look, I think this is just bruising. That means soft tissue injury, no broken bones. I don't see any reason for sending you for an X-ray. So I think that's just going to get better on its own slowly.
Come in. Hi, Len. Mr. Lemon, good to see you. Sorry I kept you waiting such a long time.
Is it possible to get a glass of water or I feel a bit faint?
Yeah, sure, take a seat.
I feel really lightheaded.
Not a problem, you take a seat there, I'll be with you in just a second. I've got a patient with me, but
Oh, right.
you can bring him in if you
OK,
like.
I'll move them into my room and then I'll come into your room when you're finished, all
OK.
right?
I feel really peculiar all of a sudden, I don't know why.
Have you been feeling like this all day? Is that why you've come to see me, or is it just happened now?
No, it just happened out loud. I just come over and I feel like lightheaded.
OK. Ever had an episode like that before?
No.
Ever fainted?
When I cough too much, I faint. I pass out, which has happened, I don't know how many times, but...
Any feeling of your heart's racing at all?
No, but I'm getting all hot and I feel a bit sweaty and cold and I don't know.
OK.
Very odd.
Do you mind taking your jacket off in a minute so I can just check your blood pressure? What was it that actually brought you here to see me today?
I'll need my doctor's certificates run out and I need some of my tablets, some more tablets. Oh, sorry, I feel really strange.
Just relax. OK, just roll your sleeve up for me. OK, do you mind just standing up for me? If you stand like that... You do?
Yeah.
And is it a definite dizziness, or is it the actual room spinning?
I feel lightheaded. I don't know, I can't really explain it.
So let me just get this.
I've been sleeping funny as well. I haven't been sleeping too well.
Do you find yourself falling asleep? Like at times when you wouldn't expect to fall asleep?
Yeah.
Do you mind just sitting on the edge of the bed for me? Anything else changed in your life over the last couple of months?
No.
No? Got into any bad habits? Drinking too much, or...?
I do drink beer every day.
How much alcohol do you drink?
About 5 cans, 5, 6 cans.
5, 6 cans. Of what kind of drink?
Stella.
Stella. So that's, what is that, 5.4% or something?
5.
5%? Okay. Would you consider that too much alcohol? Do you know that's bad for you?
No, it's too much alcohol.
How long have you been drinking that much, do you think?
I don't know. A long time.
6 months, a year?
More than that, probably about 8, 9 years.
Do you drink alone?
Yeah.
Okay. And do you live with anyone else?
No, it's by myself.
Okay. Do you mind just sitting down, lying down flat for me?
Yeah, there's a little bit of pain there.
Yeah?
A little bit.
I think, if I'm honest, I think there's a few factors. Did you have 5 lagers last night?
Yeah.
I think if you've been drinking 5 lagers, cans of lager every night for 9 years, you guarantee you've done damage to your liver.
Yeah.
Giving bad news to anyone isn't an enjoyable part of the job, but unfortunately it's something you have to do on a regular basis, and there's no beating around the bush, you have to be completely honest. It's definitely a regular part of the GP's job.
If someone drinks that volume every day, you can't just suddenly stop because you can get into problems with withdrawal. But you certainly do need to cut down, and that might be changing the routine from 5 drinks a night to 4 drinks a night for a period of time, down to 3 drinks a night, and take it from there. I can't tell you that you want to stop, but if you feel like you're ready to stop or you want to think about cutting down, these are the people that are going to be able to help you. I mean, does that sort of scare you, or does it stress you out, or what are your thoughts on what we just spoken about?
Yeah, it does kind of scare us, because I know I'm drinking too much. But I think it's just because I'm always in my room, my bedroom. I never go out, I never do anything. My legs always get giving away, or one day it's okay, the next day it's not. I think it's just that, because I've been like stuck in the house for like nearly 2-3 years now, you know, not being able to do anything. Go out now and then, but not as much as a normal person would for my age.
I'm sorry you had a tough time lately, but I'm glad we've kind of stumbled upon it almost by chance, because it means that we got the opportunity now to try and improve your situation a little bit, not just with your health, but also with, you know, how you feel in yourself and your outlook in life in general, really. Our priority now is to get the blood test done, sort out, see where we are with the liver situation. But next time I see you, hopefully you'll be able to tell me that you've cut down a little bit, and then we can take it from there.
Any alcohol?
Yes.
On average, what would you drink in 1 week?
Probably 5 or 6 pints of beer, I'd say.
Would you have 8 or more drinks in one sitting?
8?
Yes.
No.
When you're drinking every day, the risk can be high, and the liver doesn't tell you it's not well until it's really, really not well.
Good morning. How are you?
What's different to this one and this one?
There's a Meprazole 20 milligrams, and on the back of this it says that this is a Meprazole 20 milligrams. So they're exactly the same, but just made by different companies.
But different colour, that all?
Yeah, but it's because they're made by different companies.
Yeah.
It's like Coca-Cola and Dr. Pepper.
Exactly the same.
Pretty much.
Exactly the same. Dr. Vernon, I can't help it no more, mate. I tell you. Getting pain, getting worse and worse and worse, mate. I can't understand it no more. I can't even sleep.
The likelihood is you have these things called adhesions in your tummy. Remember I said that?
Yeah.
So that's where things stick together, and then you might get some pain from time to time. But it's very difficult to treat that sometimes. The MRI scan's an important part of it, and that will show up if there's anything going on.
I'm telling you, it's very, very painful. It's not only one here. It's here to here, right? Oh, God. I can't even understand it, doctor. I tell you, I bite my tongue up, I will. Because now this one not go away. Not go away at all, doctor.
So the pain's a bit worse than it was.
It's getting worse and worse and worse.
Well, that's why it's important that you've had the MRI scan, and now things will get followed up. In some ways, it's a bit of a pity you missed that gastroenterology appointment that I organised late last year.
I know. I can't help it no
Once
more.
I have the report, then I can decide where to refer you to.
Yeah.
Okay.
All right. All right, thank you very much, Dr. Vernon, yeah? Thank you.
Bye-bye now.
All right, thank you very much.
Take care.
What might be a good idea is just to announce, you know, that they're running late, so we're not just sitting there waiting.
How your water works? You peeing normally?
A bit more than normal.
Are you going to the toilet more frequently at all?
I do suffer from dribbling.
Yeah. Does he have any problems with going to the toilet when he goes for a wee?
No.
No, no problems there.
I'm Dr. Trin. What can I do for you today?
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That is where I do have the pain.
Is it there all the time, or does it come and go?
It comes and goes.
And when it comes on, does it feel like aching, or does it feel like stabbing or a shock pain?
Aching.
Aching, okay. Is there any problem when you pass urine?
No.
No burning, stinging, no blood?
No.
Do you ever get any discharge from the penis? Anything leaking from the penis?
No.
Any creamy anything coming out?
When I'm not peeing.
Okay.
No.
All right. I'm going to have to examine you down below. Would you like me to call the chaperone? Yeah. You want someone else in the room?
Somebody else in the room.
Because I'm a female doctor.
No,
okay, I will ask somebody to come in.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help?
The thing is, the baby clinic finishes at 2:45.
Hello. How much do you weigh?
I've got a patient on the line. Her baby is a year old and he's come up with a rash. She's quite concerned about it.
Can you point to where the pain is?
This.
Okay, so it's the it is the testicle.
Yeah.
All right. So I'm just going to examine here. Any pain where I'm feeling?
No.
Okay, all right. That's fine. Let's get you dressed again. There are lots of causes of that kind of aching pain. One of them is an enlargement of blood vessels by the testicle. So I think I will request an ultrasound. What we should do is maybe do a few more tests. I'd like you to do a urine sample for sexually transmitted infections, just to rule that out. Is there anything you want to ask me?
I was asked to do some tests.
Okay, so they were just some routine blood tests.
Yeah.
Fine, so let's have a look at the results. Your cholesterol is okay, liver function is okay, kidney function is fine, and we did an HIV test which was negative. The test, however, it doesn't detect if you've picked up HIV within the last 3 months because it takes that time window for the results to show in the blood.
Okay.
So, when's the last time you had sexual intercourse?
Say a year plus.
Okay, all right. That tells me that as of 3 months ago, there was nothing positive.
Nothing.
So if you've abstained from sexual intercourse for that time, there's no reason we need to worry.
Okay.
Okay, so once you've had the ultrasound, give it about a week for the result to come back to us, and then book an appointment to come back and discuss the findings.
Okay. Thank you very much.
Okay, my pleasure.
Yes. Yeah.
Take care.
Thank you, bye.
Bye-bye.
Hello, Doreen. Come in. How are you?
I'm not too bad, thank you.
Good. What can I do for you?
I seem to have been bitten by an insect.
Oh, where?
On the leg, I'm afraid.
Doreen, you poor thing. Put your foot up. You need the antibiotics.
Antibiotics?
Absolutely, it's spreading. Look, all that redness. The actual strong red bit's about 3.5 centimetres by 1.5. When did you...
Yesterday.
Oh, good. And that's come from yesterday?
Yes.
Did you feel the little biter?
No, I didn't feel anything.
You never see them, usually, do you? Well, it's pretty powerful, isn't it?
It is.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Sometimes it's worth even drawing a biomark where the line is, you know, like along here, because that should start to get smaller over the next 2 days. If it's not, you've got to ask to be seen by the emergency doctor, because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
Oh, dear.
No.
Now, all you'll hear is different sounds. The slightest sound, Joyce, from this ear. Right. You say yes. Here we go, Joyce.
Okay, and I'd just like to follow my finger, keep your head still. I'm just going to shine a light in your eye, if that's okay? Up and down.
Yes. Yes.
Well done.
What's the problem?
Do you know what the problem is?
Yes, in my throat.
It's got a sore throat
Right.
and a bad cough.
How long's it been there for?
In my throat.
I think at least a week, isn't
About
it?
a week.
Yeah, that's the way.
Let's have a look in your throat then. Give me a nice big like this.
Yeah.
Oh, wow, that's really good. Let's have a look here. Say for me. Beautiful. Good. Everything looks really good back there.
Yeah.
Yeah. Let's have a feel around your neck here. Good. Do you want to just pop your jacket off and let me have a listen to your chest? Right, let's have a listen to your chest then. Okay, deep breaths in and out for me. Excellent. Stay there 1 second, hang on. Right, all right. Do you mind if I check your blood pressure whilst you're here, Tony?
No, that one got quicker though.
That's got the fistlet, all right.
Hey.
Thanks for reminding me.
Can I wipe my coat?
I'm glad somebody knows what we're doing today. Right, there you go. You can watch the numbers go up. Your blood pressure is 123/76, which is perfect. That's perfect. You're very happy with that?
Yep.
So that's very good.
Yay.
In terms of your sore throat and cough, I'm not worried at all. I think it's just a straightforward cold, a bit of a virus, which you're going to get better from all by yourself. Now, as part of our normal tests in looking after your kidneys...
my kidneys, my mum's kidneys.
Your ones.
Your kidneys.
Yeah. And my mum.
And your mum's.
Yeah.
I was wondering if we could get a sample of your urine.
Okay.
Which just means that you need to do a sample in there and hand it into the reception on your way out. Okay? Was there anything else I could help you with today?
No, I think that's it, thanks.
All right?
Yes, Michael.
Right, okay.
Take care, Tony. All the best. Lovely to see you again.
Yes.
It's okay, Michael. Bye-bye. Bye, Tony.
Sorry to keep you waiting such a long time. Please come and take a seat.
Okay.
So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month been more down and up, getting low again, getting very depressed.
Mm-hmm.
I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and it's the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and it's just stable on my methadone and that, but because I've used drugs a lot in the past, and, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know, it's just the way I am.
Do you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything, yeah. But
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out, you know, what they understand about the situation, and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that it's still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Do your mum or your son come into your thoughts as well?
Only family really now, yeah. Do you know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if you go and get in touch with us, you need to pick up the phone and talk to Mind. They've got a good helpline, or the Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that, yeah.
And I started you on some tablets as well. Do you take them every day?
I do, yeah.
Okay.
But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it. When do I run out of tablets?
Yeah.
When do I see the GP next?
Yeah.
So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I see you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.
Morning, hello.
How you doing?
Okay, thank you. How are you?
Not bad.
Why am I poking your belly?
Well done. Oh, well done. Right, make sure I've got the right person. Give me your name.
Leslie, Jane Bernard. Yes. Left arm or right arm?
Now, you're the one that keeps telling me you've got fabulous veins, right? So let's have a look at this one.
Yeah, look, I've done this one yet. It's mostly that one.
Well, let's see, because this is nearest.
OK, here we go.
Anyway, have you starved yourself? You've not eaten?
I had about 12 o'clock yesterday afternoon.
That's all right. But not this morning, because these are fasting bloods, all right? Let me try that one. How's your mum?
She's fine.
Do you live with your mum?
Yeah.
Yeah, I thought you did. So you've got lovely veins.
Ooh.
Right, put your hand on there.
I'm a brave boy.
You are. You deserve a lollipop for that. Now, listen, these go off today.
Yes.
And the results will be back for Tuesday.
OK.
Right. Let's just put a bit of tape on you. Go and eat something decent for breakfast. There you go, you're done. All right?
Look at that. Good old arm.
OK, take care.
Thank you very much.
You're welcome, bye.
Have a nice weekend.
And you too.
So the swelling itself only started yesterday, and have you had lots of discharge?
Yeah, I've been bathing with salt water every few hours.
Okay, so if you want to go ahead and use that to... Yeah, that's it. Perfect. And is it painful?
Yeah, the upper eyelid is very painful.
Okay. I'm just going to hold your eyelid up a little bit.
That's painful.
That's painful. Now, does it hurt when you move your eye about? I can't see very well.
I'll try again.
Can you see my finger?
I can.
Keep your head still and just follow with your eyes.
I don't think I can do that.
That's painful. Yeah, OK, you've had no insect bites or anything up there, but you have been unwell with sort of cough and cold symptoms. OK. The sinuses, there's one here called the ethmoid sinus, which is very close to the eye. And sometimes it's possible for infection to spread through. My worry would be, because I can't get the eye open very well and because I can't assess the eye movements, if there is any infection around the eye, if that tracks into the muscles that are close to the eye, we could be in trouble. I think we're going to have to get you over to St Thomas's.
When?
Today.
You're not joking.
No.
I can't do that.
Yes, you can. Why can't you? You're already off.
There is Moorfields.
No.
No, that's a bit of a way away.
No.
This is not a negotiation.
Oh my gosh.
Present this to reception when you get there. So, Good luck.
Thank you very, very much.
Hopefully it will be just very straightforward and they can send you on your way and everyone will live happily ever after.
Thank you.
Excellent.
Thanks a lot. All right, have a good one.
You too. Oh, thank you.
I haven't got any appointments that have been cancelled today. You'd have to give us a ring at 8 o'clock tomorrow morning for a same day appointment. No, you need to phone in at 8 on the date you want the appointment. OK then? Thanks, bye.
Hello. Come and have a seat. Natalie.
Yeah.
How are you?
Well, I've come back, so I'm still getting this real tightness in my chest at night. I feel like somebody's wrapped a belt around my chest and is pulling it really tightly.
On the front bit of your chest?
Yeah, sort of right here.
On that left?
Yeah. I will find that I sort of have to sort of stop to sort of take a breath in.
Is it that you feel you can't get enough air in?
Yeah, that's how it sort of feels. But then when I lie down at night, I get this sort of quite severe sort of chest pain.
When you lie down?
Yeah, it's when I'm lying down.
We doctors always think of the worst things first.
Yeah.
Your pain doesn't sound to me like anything to do with the heart. So we then think about what might be going on in the lungs.
Mm-hmm.
And you've got a normal chest x-ray.
Mm-hmm.
So, you know, I'm thinking, is there something else going on in the lungs?
Yeah.
You would have to speak to the duty doctor regarding that because it's a medical question.
You need to run tests on him because his immune system is amazing. He had exactly what we all had and he's better.
Sorry to burst your bubble, mate. It's not your amazing immune system.
If I press on any of these bones, do any of these hurt? Going down here. Am I producing the pain you get in that side of the chest?
Yes, yeah, you are. I can feel it sort of...
Coming across there?
Yeah.
But I'm not actually hurting, so
No.
coming down...
Yeah, that's...
Sorry?
It's right there.
And that is the pain you're getting going right across the chest?
Yeah.
OK. Let's turn around and listen around the back. Take a really big breath in and out. Does that hurt?
Yeah.
Sorry. And where it hurts is there?
It hurts like here,
Round here.
coming round underneath my breast.
OK, let's come and sit down. And you've had this a long time?
Quite a while now.
Wow. I think some of the problem is a condition which I'm going to give a funny name to, called Tits's disease. Right? There's a joint between the end of the ribs and the breastbone. And for some reason, there is something becomes inflamed, that particular joint.
OK.
And Titsy's just the name of the guy who discovered it.
OK. Is there anything I can do about it?
Well, they do say take anti-inflammatory pain relievers. Sometimes physiotherapy can help a bit. So I don't think it's the end of the world. I'm sure we can probably help.
Thank you so much for being so thorough.
That stretches my diagnostic skills, but I think I've got the right diagnosis.
I wanted to do the poo sample and check there wasn't a bacteria in your stomach.
Everything feels normal when you're wiping your bum and... Yeah, OK.
You don't pass jet black sticky poo.
Yeah, maybe.
He's done a poo, hasn't he?
How can I help you today?
My mum just found out recently she's got cancer and that. So I just want to get myself checked out basically to just make sure that everything's okay, really. Yeah.
Tell me what happened. What with your mum? What's she been diagnosed with?
She went for a checkup, actually colon checked and stuff, and they said that she had cancer spreading from her kidney to her lung.
Quite tough then.
I just want to get myself sorted, just checked, just to see if I'm okay, really.
Are you worried that you might have cancer then, or?
Yeah, because her mother died from cancer as well, so I'm thinking it might be hereditary, so
How have you been in yourself?
I've had slight murmurs. Like, it feels like it's Mr. B or something. It's like like I've been running, but I haven't.
Do you get other symptoms?
I've been passing urine quite frequently as well.
Because of those symptoms, with peeing more frequently, I just need to ask you a few more sensitive questions. Okay. When was the last time that you had sex?
I'd say a month ago. 3 to 4 weeks.
Was it with a regular partner?
Yeah. Yeah, I would say so.
Have you had sex with anyone else?
2 people besides this girl, but they're all regular.
So you're having sex with 3 different...
Yeah, basically.
Do you get any discharge from your penis at all?
Nah. No, I don't think I've contracted anything like that.
What we can do is listen to your heart and lungs and take a look at your stomach. So sit up for me. Sit up. Deep breath in that. And out. Okay, and then. Okay, your chest and heart sound fine. I'll get you just to lie back for me and I'll take a look at your stomach. So just gently press. Yeah. So it's not painful at all. Okay, your stomach feels okay. And what I'd say is examining you, to me, everything is normal to examine. Okay. So that's reassuring.
Yeah.
I mean, you're telling me that you're sleeping with 3 different girls at the moment. That puts you at higher risk of having sexually transmitted diseases. So you need to make sure you're practicing safe sex, so using condom.
Yeah, definitely, definitely.
But you are at high risk of the fact you're having 3 different partners. So I could get you to do a urine sample to test for chlamydia and gonorrhea. Have you got details for the sexual health clinic as well?
No, I haven't. So if you've got a number, I'll be very
I can give you details if you want to have a full check.
Yeah, thanks very much for that.
All right, no problem.
Come in. Hello. Come in. How are you today?
Fine. I think Bailey might have chicken pox. He's come up in the little spots, so I just wanted to check to make sure.
Has he been in contact with anybody with chicken pox?
His little cousin has it.
So when was he in contact with it? Week, 10 days ago?
Very recent.
Yeah.
Very recent.
Should we have a look? Oh, yes, we've got some spots on his back coming out. Here. Can you see? They're coming out in little bumps in blisters first.
I can see that.
Then they usually become a sort of yellowy pussy for a little while, and then they become scabby. So have you got any on your head? Let's have a look.
A little bump there, I can see.
Possibly, and possibly a little one there, isn't there? Yeah. Shall we have a look in your mouth now? Hasn't actually got anything in his mouth yet. It's got a wee bit of temperature. 37.7. Right, the normal is 37.5 and below, so it's just a fraction above normal. I think it probably is going to be chickenpox, to be honest. He's actually infectious 6 days from when the rash comes out. Now, the spots won't have gone by the end of that 6 days, but they will be scabbed over and his temperature will be down. But, you know, he needs to be off school, I'm afraid.
Yeah, that's fine.
Is that all right?
That's fine.
It's a good thing to get it over with, you know. Well, there we are. Champion.
Thank you for your help.
Good, bye.
Bye.
God bless you, Doctor.
Take care.
Thank you very much.
Thank you. Bye-bye.
Bye-bye.
What a good doctor you are.
Take care. Lovely to meet you.
Thank you very much.
Go away. Behave yourself.
Take care. Bye-bye.
Thanks for your help.
No problem. All the best. Take care.
All right.
Take care. God bless you.
You take care too. See you again. Bye-bye.
anus would get very sore. Every day I'd have to put Vaseline around the opening.
Is it a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, and where did you get it from?
On the internet.
When you self-harm, is that cutting?
I get really, really bummed out sometimes. Just everything's all doom and gloomy.
So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor. I think so.
I've got months to live.
Is that what they've said?
No more treatment, they're giving up on me. And they say how much time I go.
Good morning, Putney Mead, how can I help?
Should I book you in for Wednesday the 5th?
When?
Wednesday the 5th of November?
For today? Don't have anything left for today, unfortunately.
Sorry, Wednesday the 5th.
I don't know how...
Wednesday.
It's with Dr. Diman. Yeah, it's a lady.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh.
Right, 6 months since I saw you last.
Is it 6
It
months?
is.
Yeah.
What's the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like a little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, before I go to bed. So, yes, there has been problems with my bowels.
Okay, Hans, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. That's good. And this one. Good. Okay, fine. And relax.
You did examine me, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Yeah, prostate, I think, probably.
Oh, was it the prostate?
Yeah. You've got to have long fingers to feel your kidneys that way.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff. They think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So,
Hi.
How are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. But yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I don't know how long it was for, but I wasn't taking any for that period.
Was that, did you just run out, or did you choose to stop?
I ran out and I couldn't afford it again.
Yeah, okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into like anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that you had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. Only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's very difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay.
Do you get constipated? Or?
Yes, both.
Yeah,
Both. I have both. Yes.
She's going to toilet perhaps 6-7 times in the morning and in the afternoon, and then again during the night.
Gosh. I still have a really bad stomach. Everything I kind of eat still.
It's coming straight through.
Yeah.
Is there any blood when you go?
Sometimes, yeah.
And is it loose?
It's more mucousy.
Okay.
Are you passing a lot of gas? Yeah, okay.
I can't go out unless I know where there's a loo.
Yeah.
You know, it just winds me up.
So has there been any blood in your diarrhea? Or the looseness, really, that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to, this was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the feces, and it was wet, and that's happened about 3 times, where on country walks, I suppose. In fact, it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily, now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
McKenzie.
What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? And any thoughts of trying to do more than that?
Thoughts, but I don't think I'd act on them.
So in terms of today, Was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Fine, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing there tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Good morning, Putney Mead. Rachel speaking.
Say ah.
Just look up for me.
Ah.
Can't really get to see your tonsils.
I mean, I took a phlegm sample. There's a bit of blood in it as well.
Yeah, I don't think I need that sample somehow.
Hi, Onda. Come in. How are you? Sorry to keep you waiting.
You were always late.
I know. I'm so sorry. Come and have a seat.
I haven't got better now because I've been really ill.
Because you saw Dr. Andrews, didn't she, because of your chest?
My chest has been unbearable.
Because you were on some antibiotics initially, were you, or not?
Well, they prescribed them.
Yeah.
And I didn't take them because I thought I don't want to mix the antibiotics and the pump. Because I was taking the pump as well because my chest was really bad.
And have you had any temperatures?
I was getting hot. I thought, do you know what I mean? So lots been happening.
Sounds like it. Let's pop this in here. Okay, so your temperature's all right.
Yeah.
You take your jacket off and we'll have a good listen.
I still got a bit of a cough, but not. Because I'm going away on Sunday.
Are you going to Blackpool?
It's Sunday, because it's my birthday on Sunday.
Oh, lovely.
So
you want to get well for that?
Yeah, so I don't want to be ill. That's what it's, do you know what I mean?
Do you want to lift your shirt up so I can have a good listen? Big breath. And just sit forwards. Again. Chest sounds all right, actually. I can't hear any wheezes today.
Can I check my weight while I'm here?
Yeah, no, of course.
Because I think I've got on my... Everything's gone pear-shaped at the moment.
On you go. Well, only 1/2 kilo, so it's not terrible.
Well,
but, yeah, we do want it to go the other way, but...
But to tell you the truth, Dr. Wallace, I'm trying to do it myself before going to Slimming World.
I think you should go to Slimming World. What's putting you off?
I've lost the form.
You've lost the form?
Yeah.
Do you need another one from Laura?
Not being that I haven't done it deliberately.
No, it's fine. I'll speak to Laura and I'll get her to sort out another one for you because I think it is important to have the kind of support of Slimming World.
Also, I've cut down on my drinking.
Good, because that's empty calories.
But I haven't drunk for 2 weeks.
Good.
But I'm going to have a little drink next week. That's because I'm away, so you do, don't you?
No, definitely. It's got to be a combination of diet and exercise.
I mean, my diet is quite good, really.
Good morning. Sorry, I don't know where I'm going in the afternoon.
I've got some pecans, a valuable source of protein and amino acids.
You can.
Oh, God, I've got a bit of old cake in there. Jesus. There we go. Come and have a seat. What are we doing?
Strange comment. One is, I feel like something's growing inside me, but I just wondered your comments. But the other thing is, I notice in the mornings my skin's tingly.
So tell me about this thing growing inside you.
Oh no, it's probably just I'm just overeating. But it just.
Do you think
feels
you've
like
put on
massive,
weight?
Yeah, I've got a massive gut, which I didn't used to have.
And how much weight do you think you've put on?
Oh, I know. I weigh 14 stone.
Okay.
But I haven't been exercising for a year.
Why's that?
Lots of things happened in business, and I didn't have the stomach for it. Pardon me. Yeah.
Your eyes look a bit sore.
Oh no, that's out for a birthday dinner last night.
Oh, sorry.
Yeah.
So how much are you drinking, do you think?
Oh, at least a bottle a day of wine.
So more than you did?
I don't know what I said last time. We all lie, don't we?
I don't know. You know whether you lie or not.
Well, it's about the same, really. Yeah.
So you drink at lunchtime?
Yeah, I like lunches. So lunchtime and always in the evening, anyway.
Yeah.
Yeah.
Should we feel your tummy? I think that we need to do that. So slip your thing off. So maybe we should just do a whole load of bloods again and just check on everything.
That's fine. Just sit down.
Yeah, just lie down.
Lie down. Okay.
Come in. Hi there, hi. Have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because I'm from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. Would you just explain a little bit more about what the prescription is for? And
it's my ADD, as well as I've been having difficulty concentrating. I'm going for a master's right now, and I guess I've been doing without them, and it's not good.
Right, okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines. But I think in America, it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription. Do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or...?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
done. It helps, does it?
It does.
Are you sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like I'm just, I don't know. I guess like if I did get like a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves.
Okay, what's the problem today?
All right, I took the medicine for losing weight, and it's finished.
Okay, if you take your jacket off, we better see if there's any evidence that...
Yeah, I hope so.
Okay, where you go. On your pop. Okay, 123.8. Right, so the last weight we did on you was 5 months ago, and you were 124. So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor.
Right.
I think so.
Okay, well let me...
a bit lighter,
So with Orlistat, there are some fairly strict guidelines for us to prescribe it.
Okay.
So continue treatment beyond 3 months only if weight loss since the start of treatment exceeds 5%.
I'm trying to lose weight and it's just not really working.
Okay. I'm going to just wait until it goes 0, 0. There we go.
Okay. So how much weight do you think you've put on?
I'd probably say a stone.
Yeah.
So you've put on 2 pounds.
Oh dear.
Okay.
The body mass index doesn't come up very well with me.
Yeah,
because it basically doesn't take into account my build.
You probably haven't pushed yourself as much with regards to the exercise.
To be honest, when I get out of work, the last thing I want to do is go work out.
I leave the house at 7, and by the time you come back...
The motivation is...
Yeah, I know.
I want to go yoga.
Oh, yes.
Which is very good.
Yes, very good.
The trouble is, I don't know, I shouldn't say, but it's so grim.
What we're trying to manage with it is preventing things from happening in the future, like heart attacks and strokes.
We're not all sporty, but actually having a think, what you might enjoy from an exercise point of view is worth it.
And you were referred to the dietitian.
Yeah.
Is that happening? Still?
Yeah.
Changes?
Yeah, I changed my diet. But because of my knee, I can't do much exercise. The physio told me I should stop.
Yeah, but obviously your knee was stopping exercise, but the Orlistat was stopped because you'd not been meeting the weight loss target. You know, their role is to help you with your diet and weight loss and exercise and performance. If they think that they're not succeeding and that we need to do something else, they might recommend to us that we prescribe something like Orlistat. The reality, though, is that having had it, it's not really achieved the targets that the NHS dictate to me as a justification for carrying on that prescription. Okay?
All right, can I have a painkiller?
You can have a painkiller.
So was it a good party last night?
Yeah, it was. Yeah.
Okay, up you get. Put your things on. Let's just check on stuff and then we can see you back with the results. Tummy feels fine. I can't feel anything there that's...
Just slack.
A bit of slack. I mean, if you can manage to get back to your exercise regime, you're going to feel so much better because you always do, don't you? Take that and then you book an appointment for a blood test with the healthcare assistants.
Fantastic.
And we'll see you afterwards.
Thank you very much.
Okay.
Have a good weekend.
Yes, I hope so. And you. Not too good.
I've got this kind of freckle thing here, which I don't think I had when I was little.
Has it changed at all?
No, it just gets a bit more crispier because I just picked a bit off.
You don't pick and squeeze things.
Squeeze it all the time.
I've got a spot on the end of my nose. And I look at it every morning.
Last Monday, my hand started peeling and all the skin came off.
Pretty classic for something called seborrheic dermatitis, which is triggered by yeasts.
Yes, it feels very much like eczema.
Yes, I get it on my face, on my torso, on my legs.
Okay.
How can I help today?
My psoriasis has suddenly flared up.
Okay.
Over the weekend on my hands and my feet.
Do you mean psoriasis or do you mean eczema?
Well, I was told it was psoriasis last year,
Okay.
but I don't know whether it is or not.
It certainly looks like eczema to me.
Oh, right.
And we haven't got you coded as having psoriasis,
Oh.
but I can check.
With a P, psoriasis, yeah.
It's a silent
Oh,
one, that's why we
okay.
call it psoriasis. So tell me about when this came on.
Well, it literally came out like late Friday night, Saturday morning.
Okay.
And it's the same on
show me.
on my feet. You can see where all the little blisters are starting to pop.
It's quite interesting how your skin blisters.
And then they all pop. I mean, all of my feet, it all pops open and then...
What do you normally put on it?
Well, I've been using Chinese herbs on it, which I brought with me.
Okay.
Because I find steroid cream makes it flare up and then all the skin splits.
Okay.
So...
Chinese cream often is made of steroids.
Oh, is it?
Yeah.
Because I find this doesn't work. Those are pills, and then they gave me this. Problem is, it's written in Chinese.
So I mean, I have no idea how safe this is or anything, but there is a lot of people that say that one of the reasons why Chinese medicine is so effective is it's got a whacking dose of steroids.
Oh, really?
Yeah.
I didn't know that.
But not monitored.
Of course,
and so
sure.
not safe from that point of view.
And it would be in the pills as well?
It could be.
Okay.
So I can't recommend them, obviously just because we don't know what there's in them.
No.
There have been case reports of these medications containing dangerous levels of mercury, arsenic and lead. There was a big case last year which showed that they even contain parts of endangered animals. And although they're sold as being natural, that doesn't necessarily mean that they're safe.
Now, your liver function isn't entirely normal. Are you on any medications at all?
No.
Anything herbal or anything over the counter? Any supplements or anything that you're taking?
Yes, I did take, yeah.
What's that?
That's the it's a natural stuff for it's a sexual thing.
Okay, so it's a herbal thing.
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
Okay, I would stop that, because do you actually know what's in it?
No.
Let's stop it just in case, because some funny herbal stuff can make your liver test go off.
Okay.
Some medication that's being sold as alternative or natural contains the same ingredients as pharmaceutical medicines. So one example is a herbal remedy that you can take for erectile dysfunction, which was found to contain sildenafil or Viagra, which is a medication that has lots of side effects and can be dangerous if it's not prescribed under the right conditions.
I actually tried one of those Chinese places along the road, and I'm not sure if that made it worse.
What kinds of things did they try?
She was thumping it.
Right. Okay.
And then asking me to like chanting, all that kind of stuff, like fake. I don't think it was.
So probably at the moment, I'm not sure if chanting is going to sort out your neck.
Good morning, Putney Mead. Naomi speaking. Hello? This is Putney Mead. How can I help? Putney Mead.
So how are we today?
Pardon?
How are you today?
Yes, how can I help? How can I help?
Thank you very much. I am not bad.
Not bad, okay.
Dr. Smith? Dr. Smith?
Oh.
That's sore?
Yeah, very sore.
She won't be able to phone you because she's in a clinic. She's in clinic today.
There's a little bit of normal wax in there, but nothing that's causing deafness.
All right, take care. Bye-bye. 100 years old. That's crazy.
Hello there. Come through. Sorry to keep you waiting so long. Come in. Come and have a seat. So how are things with you?
Not so good.
No?
It's a day, and so other day, you know, down the weather.
Yeah.
And I got months to live.
Is that what they've said?
They say, you know, anything they do make it worse. Now it's come out from the lung, it's my organ. So no more treatment, they're giving up on me. Okay. I'm planning to go in Italy Thursday.
Are you going back to Italy to sort things out, or what's going on there?
Well, I've got a nice flat there.
Okay.
And then give something to the friends, cancel all of the banking and all sort of thing, you know. Now, do you think I need something on a plane? Because the plane is pressurized. And with my breathing.
Yes, that's what I wonder. Let's check your oxygen levels.
Okay. The arthritis attacked me in my shoulder, my neck.
Just relax your hand down. There we go.
I'm disintegrate.
But you're still smiling.
Yeah, no, I keep smiling. People say nothing wrong with you.
Oh.
Oh, my favourite. I'm very fond of raspberry jam.
We know on the X-ray there's a little bit of wear and tear in your spine.
About 3 weeks now, I've had pain all down my leg, and I was worried maybe it was my hip.
Obviously, I overdid it because I think I'm 20 and I'm not.
I'm afraid that's fairly consistent with being 83 years of age.
It's no fun getting old.
Yeah, I know. People say.
Did you ever have TB when you were younger?
No, no.
Never. And just remind me, you were a smoker for quite a while.
Yeah,
weren't you?
and not only that, the job I'd done, but that's the coaling and...
What job did you do?
As a coalman.
Right.
You know,
Okay.
you're too young to remember.
No, I am, but I know what they were.
Coal on your back, you know, the old, I mean, I'd done that for 25 years. I carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You know, you either did them or somebody had to do them anyway.
I think what you're going through is related to all that.
Well,
and
oh yeah, I
smoking
do
in the
honestly.
past.
Oh yeah. I can't think of anything else really.
No,
You know.
no. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in the bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips blowing round in it. Oh, God. I'll never again. But anyway, I digest as usual.
I can't do it. It's quite hard. I mean, my granddad's
Scotland.
Scottish. My granddad is Scotland.
There's a
wee chance of that. Someone cast me as Japanese once.
What?
I know. I went.
Are you serious?
She was like, "You got that Oriental look about you." I was like, "No."
So deep breaths. Good. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
that scarring.
Bit of a chest, like, you know.
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
no.
But that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh, yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Big breath and then breathe out as hard and as fast as you can. That's it. But short and sharp, not quite so long. So really try and... But better. Do it stronger than that. Really try and blow the end off. I think that's best you got, wasn't it? OK, you have a sit down.
Okay.
Let's have a little look at your things here.
I tucked myself in.
OK. Do you want a hand? Are you OK? Do you take any regular inhalers or not?
No, not regular.
I wonder whether it might help, because, I mean, there's a little bit of a wheeze there, but should we give it a go?
Yeah.
What I want to do as well is talk to the chest clinic, who know you very well, and just get their advice about how safe it is for you to fly, the risk of the cabin pressures and things like that, and whether, if they think it is safe for you to fly, whether you need to have oxygen on the flight. I mean, obviously, having lung cancer, it is going to make flying dangerous, because we know you've got a lesion in one of the big airways, and the risk is that could obstruct and make your breathing substantially worse. The other thing is, when you've got cancers, it does increase the risk of you having blood clots in the legs and the lungs. So I would recommend getting some flight socks for when you go on to the flight. Don't drink any alcohol, and just try and keep your no alcohol, because that dehydrates you and it increases the risk of you having blood clots.
I got to go there. Maybe because they say the hospital go as soon as possible.
And I mean, obviously you've been told that there's nothing more they can do at the hospital. Have you had any thoughts about what you want to happen or what you don't want to happen as things
We've
continue?
been talking about the heart stopping. You want the revival, say no, let me go.
Yeah.
What's the point?
Yeah.
And I hope I'm going to have a nice birthday down there. I'll be 77.
Will you be over there still, or will you be back here?
Of course I've got to be back here.
You'll be back here by then?
Yeah.
Okay.
If you're still breathing.
That's it. And this is now fetal heart.
She's got an ear infection and lots of stuff is coming out.
You haven't done anything wrong, but I think that's just got infected. Ugh.
He doesn't want it.
No, he doesn't, does he?
Hold still, my sweetie, hold still.
That's a good grip that you've got. Just trying to stimulate his gag reflex, which is not nice.
No.
So mean.
Sorry.
She's so mean. Well done. Over.
I'm Dr. Mackenzie. We spoke a few months ago.
Yeah. Now, when I last came in, I was pregnant, but unfortunately I had a miscarriage. No, that's okay. But I'm pregnant again, which is great. But obviously I'm really, really nervous. Every time I go to the toilet, I wipe and I'm scared I'm going to see blood. I'm just on tenterhooks all the time. And I was just wondering if I could book an early scan, if that's at all possible.
There's certainly not much point in having it done at 7 or before 7 weeks
Yeah.
because it can sometimes be inconclusive,
Yeah.
surprisingly.
Yeah.
So you don't want any negative information. You want
Yeah.
to either know that things are fine or not fine.
Yeah. And do the risks of miscarriage decrease quite significantly after 8 weeks? when you're safe?
Statistically, probably a fifth of all pregnancies are lost as early miscarriages. So about 1 in 5.
Okay.
So having had one miscarriage is, I'm afraid, not uncommon. So cross fingers, not going to
Yeah.
happen again this time.
Yeah.
But even if it did, the advice would remain, well, okay, let's wait for a normal period.
Mm-hmm.
And then you try again.
Again, yeah.
If this one happens the same as last time, well then, as I say, it's sad and upsetting,
Yeah.
but it's not the end of the road.
Yes. Yeah.
To try again is
If I had one miscarriage, is it more likely I'll have another one, or is it completely...
completely independent.
Yeah, yeah, okay.
All right.
Oh, gone. Can't be that bad.
Come in.
Hi.
Have
How
a
are
seat.
you?
What can I do for you today?
I've just found out that I'm pregnant and I wanted to check in with the practice and
Okay, yeah.
go through whatever we need to go through.
Okay, is that good news?
Yeah, good news, good news, good news.
Congratulations.
Thank you very much. No, quite sudden. I hadn't come off the pill for very long, so I can't believe I'm pregnant this fast.
Okay. And was it something you were trying for?
Yeah. I came off the
Yeah.
pill deliberately, so yeah.
You taking folic acid?
No.
No.
Okay.
I'd suggest taking folic acid and vitamin D.
Okay. The other thing that I have on my mind is that I was training for a marathon,
Yeah.
and that's due on Sunday. I'm concerned of running a distance like that in such early pregnancy would have I don't know.
Okay. I think because the risk of dehydration and things is quite high anyway.
Mhm.
I know you're not far on.
Yeah.
I just wonder to be on the safe side. I'd say no. Is that all right? Sorry about that.
No, it's fine. I kind of was getting there myself, but it's...
Yeah.
Yeah.
Okay.
Yeah, that's
I'm
fine.
sorry about that. Though,
No, that's fine,
Because
that's
you'll
fine.
have worked very hard.
I did. I
to-
spent the last 6 months training. Look, this in itself is...
Are you desperate to do it?
I was. What's more important to you, your health, your baby's health, or running a marathon in the grand scheme of things? You're gonna,
in the grand scheme of
you'll
things,
get
you can
over the
always
marathon.
enter next time.
Yeah, exactly.
Yeah.
Yeah.
So how are you anyway?
I'm okay.
Okay. So the last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look
Sorry,
nervous.
I'm so sorry.
Why?
I tried to overcome it without anyone knowing that I am very nervous. You know, I'm a
What are
bit
you
like that.
nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think it was he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you, you know, and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, OK?
Yes. Thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
Bye.
Cool, thank you very much. Have a nice evening.
And you.
All right. Thanks a lot. You're welcome.
Bye-bye.
Oh, thank God. Oh, finished.
Sometimes if you have sex too much, your semen quality goes down.
Okay.
So during that fertile period, is perhaps not have sex so much.
Okay, all right.
I'm really feeling down. I'm feeling really suicidal. It scares me at the moment.
You aren't the normal Sammy that you were a few weeks ago.
I don't think I need any medication.
Right, okay.
I definitely don't think I'm getting ill.
You've got to remember that you're a very good age. Sometimes you've got to slow down a bit.
Yeah, I know, and I don't want to slow down so much.
Any thoughts regarding work? You're 33 and not worked for 10 years, and
Yeah,
you
I know,
know
it's shocking.
the chances of returning to work are
dwindling as we speak.
Yeah.
I know.
Morning.
OK, that's all booked. Bye. It's going to be a good day, Nana.
So anyway, how are you getting on?
Well, I'd like to ask you a question, whether you can answer it or not, I don't know. And that's the nicotine, I think, from smoking has lodged in my arteries.
It's not the nicotine that's doing that to you. It's all the rest of the rubbish that's in a cigarette and chemicals.
Yeah, it's a fine dust, basically, isn't it, smoke?
Yeah, well, it's killing you. And that's what's going through your arteries. How many cigarettes have you smoked since you saw me Thursday?
4, 8, about 12.
Okay, so I thought you were going to use the patches and the gum and not smoke. That was the idea of this.
Well, I did, but I cannot resist.
So you're still craving for cigarettes. So then the regime that I put you on is not high enough. You've got a 4 milligram gum. Have you been using the gum?
Well, I don't like to criticise it, but it's inclined, I think, to give me like indigestion.
Yeah, it does. It can do. It can do.
You know about that, okay.
How about a lozenge? I tried to try a lozenge instead. So what you do is you suck it and you park it, you suck it and park it, and you keep doing that.
What flavour are they?
Mint.
Oh, yeah.
Is that all right?
Yeah, that's fine. Very limited on that, I expect.
Oh, there's not a lot of choice, I'm afraid.
No.
Okay.
I'm not being picky.
Okay.
I'd like to try them if I can.
Okay, and I'm going to up the patches, so 5 extra milligrams in it. And we'll see if that regime helps then.
Okay.
So, are you going to come back and see me next week?
I have to check my diary.
Okay, well, I'll make a new appointment because you need to see me. This is something you need to come back and see me for.
Okay.
All right?
Yeah.
Hey, little man. Hello. Hi. Hi.
I'm so sorry. Yelp if you need me to.
It's all right.
But we're just concerned that he doesn't seem to be...
It's tough coming into the big world, isn't it?
Calming down, gaining weight. He has gained weight.
So what are the things that you've noticed, Barbara, that make you worried about Sammy?
So there was lots of things which changed. So, for example, you are more energetic than usual. So it seems like the reactions are much stronger than usual. Also, you sleep with service charges, which never happened before.
Sorry, what was that?
Stopped paying service charges, which is very unusual.
Okay, so you have to pay service charges?
Yeah.
But you're not doing it?
No, I'm just behind in arrears. But in a week's time, I'm paying about £100 towards that.
How did that happen, that you got in arrears?
I just slipped behind in payments.
Right, but then you must have spent the money on something else.
Yeah.
So what did you buy?
I just bought shaving, grooming kit.
Must have been a lot of money on that.
Yeah.
Why did you spend so much money on those things?
I don't know how to.
Do you really need them, all of those things?
Yeah, because I groom every day.
Yeah, but you obviously you used to be able to afford to buy what you needed and pay the charges.
Yeah.
But were there other things that you bought?
Some shirt, t-shirts, underpants, and cologne.
All right, okay. Bipolar disorder is usually really quite a severe mental health problem in which your mood can either be very high, which is we call either manic or hypomanic, or really very low, depressed. People become hyper. They often buy loads of stuff. Often people will buy things that they can't really afford. They may think that they're famous. I had a patient who bought a ticket on Concorde because he thought he needed to go to the States straight away for no particular reason. I mean, obviously, you've been living at the hospital there for a long time
Yeah,
now.
5 years, 4 months now. Today is 5 years, 4
Okay,
months.
is this the first time you've been in arrears?
Yeah, first time, yeah.
So something's not right, is it? Because you wouldn't normally allow that to happen, because
Yeah.
you're very responsible.
Yeah.
The worry that I think Barbara has, that you're beginning to show early signs that you might actually be relapsing.
No. Because the thing is, I saw my consultant psychiatrist on Saturday.
Did you?
Dr. Potter. Yeah, I saw him on the street near where I live.
All right.
And he said I look very well.
Right. You can't tell what's going on inside your head from just looking at you, because I would have said you look very well as well.
Yeah.
And the thing is that what we know with the kind of problem that you have,
Yeah.
that when people relapse, the first thing that you notice is not that they don't look well. They look fine. And it's just what they're doing isn't quite normal.
You're still enjoying it if you've been here for 20 years.
Yeah. Yeah. You know, it's a nice place to work and everybody's
That's exactly what I say about
pleasant.
my place
Yeah,
of work.
you know.
Why is everyone getting flowers? I want flowers.
Oh my God, is he being serious? I want flowers. Aaron, send me flowers, please.
Gonna feel and then I'll clean it with this alcohol wipe.
You're very practical about the shop. Most men are not practical.
How far do you have to be out of the borough to still be here?
So, we
'cause
have...
I don't want to leave here ever.
That's lovely.
Thank you so much.
No problem.
Thank you
All
very
right
much,
then.
Dr. Sherlock.
Okay.
Thank you.
Bye-bye.
Yes, thank you.
I think that these are warning signs. If we don't do anything, you will get ill. And we really don't want that to happen again, because you've rebuilt your life. You've been
Well,
absolutely
today is
fine.
5 years, 4 months
Yeah.
since I was discharged from the hospital.
Yeah. So you've done...
And within myself,
Yeah.
I know if I was going to feel ill when I was.
Okay, is that really the case?
Yeah, I know.
That you know? Because most people with your illness don't.
Yeah.
It's very unusual for people with your kind of illness to know. It's always other people who say you're not well,
Yeah.
and that you have to then accept that they're right, and that means you should be on treatment.
How do you feel about that, Sammy?
Well, at the moment, I don't think I need any medication. I think I've done well 5 years and 4 months since March 29th, 2010. I was discharged from the hospital.
Yeah.
I motivate myself, I go for walks, my weight is coming down. I don't think I need any medication.
Right. Okay.
I definitely don't think I'm getting ill.
Right.
I feel well within myself.
Okay. Well, our advice is you aren't the normal Sammy that you were a few weeks ago, that you've changed. You aren't as well as you were. You can't notice that. You can't see that. And that's often the case. In Sammy's case, I thought it was really important that he should be on medication now, because it sounded as though he was beginning to relapse, and that could have been disastrous for him, as he might have ended up in hospital, because he wasn't taking any medication for bipolar disorder and hadn't been taking any for quite a long time. We would generally say to somebody like you really ought to be on medication forever. When you get ill, you get seriously ill and you end up going back into hospital. It's such a huge setback if that happens. We think we can avoid it now. All you need to do is to restart treatment. He is a patient, actually, he does get the final say as to whether he takes medication or not. He's taking a chance if he doesn't take it, but then maybe he's entitled to take that chance. Are you willing to see the psychiatrist?
I'm willing to see the psychiatrist.
So
yeah.
we'll do that. We'll do one step at a time.
Yeah.
I do think it's worthwhile going down this route. So what I will do then today is I'll phone them up. I'll try and arrange that you get an urgent appointment to be seen as quickly as possible. I'm sorry, you're obviously upset about that.
Well, I'll see the psychiatrist, talk to him.
Yeah.
He can assess.
Yeah.
He'll assess me, and then he'll tell me if he thinks I'm getting ill or not.
Yeah. Okay.
I think it will be the best thing to do
Okay.
right now.
No, you're right. That's that's the right way to do it, because they're the experts.
Yeah.
Thank you
All
very
right.
much.
Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Yeah, take a seat. All right.
Morning. So, Is there anything about your health that you particularly wanted to discuss today? Asthma is another of your medical problems. Is that well controlled, or
What, asthma?
Yeah.
Well, no, I have had a bit of breathing problems recently. Not bad, but I'm not breathing as deeply as I would like to.
And you're using
I've
your
had some-
medications?
Yes, I've been using that.
Do you know what triggers your asthma? What makes it worse?
Well, I think that it's the pollution,
Okay.
the heat, the pollution, the traffic, the high road.
Have you had any falls, or do you worry about falling?
I can walk without the stick, but I'm not confident on the high road because of the kids.
Well,
on
the road is very uneven.
It's very
and there's lots of
uneven.
people about, isn't there?
And there are too many people, and they
Yeah.
don't notice you, and they bash into you, and I mean, I really think it's safer to have a stick. I think actually what I'm objecting to now is the scooters. There's so many of them.
Yeah, and the little kids as well.
and
They
grown-ups
go
on
ahead of
scooters.
their parents, so they can't even.
Exactly. They
Yeah.
don't know what they're doing. Parents are usually on mobile phones anyway.
But you feel well in yourself? Do you feel well?
Well, I feel a bit miserable sometimes, but mainly, I mean, it's just not getting around as much as I did.
The mobility.
It's just a bit depressing not to.
But I think
Not
also
to
you've
be as
got
active
to
as
you've
I
got
would
to
like.
remember that you're a very good age, and so you've got to you know, sometimes you've got to slow down a bit.
Yeah, I know. Well, I don't want to slow down so much. I mean, I do feel I've got to get out. That's why I decided yesterday I've got to go out. So I took myself, as I say, I went to Collier's Wood. And then I felt quite pleased with myself that I got there on my own, you see, on the tube without depending on somebody else being there. And then I went to Mark's and had something to eat and came back home and felt fine.
Have you ever heard of the befriending service from Age UK?
I've heard of it, but I don't think I need it. I've got friends.
You've got enough friends
I've
around.
got a friend who came in this morning, actually. I mean, I think changing the focus does help, and I think probably if I go on holiday, I will probably be able to do it.
Well, have a wonderful holiday.
Yes, it's only a week.
Well, a week is better than none at all,
A week's
isn't it?
better than nothing, yes. Okay.
All right, thank you for coming. All right, bye-bye.
When are you looking at doing your work experience? Okay, so I think this coming week might be too soon. But if you wanted to write in, then I'm sure she would consider that.
That's the only time I come in. Very good. Come in, take a seat. Busy day, indeed. Always.
William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, you know, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment? Any thoughts regarding work?
I mean, I'm still at that. I say crossroads. It's not really a crossroads. I feel like I'm just at that precipice with like no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago, really. And the gap in my CV is just so like huge.
Yeah.
That like I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well. But I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, we've got you're 33 and not worked for 10 years. And
Yeah, I
you
know, it's shocking.
The chances of returning to work are
dwindling as we speak. I know.
We want you to become productive again, and you know.
I know.
think whether
I
or not
had
the-
big dreams. I had big dreams. Like this is what my first couple of counsellors was saying. Like, yeah, you built yourself up too high.
So
mate.
the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's
at the moment.
literally that's my only option from counselling.
counselling point of
is
view.
through the drug angle. See, I'd rather talk to a wall than talk to someone like condescending with their.
Yeah. And you've said before.
I mean, what
you said
to
before?
me? What's the alternative? Go and have a drink? Like, no thanks.
Yeah,
I'd
you've
rather
said,
die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What happens if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like,
Do you know which medication that was?
I think it was fluoxetine.
Fluoxetine.
It's
What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks.
Okay.
And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay. Take
Have a
care.
nice day.
And you.
No problem. All right. Bye. Good morning, Vicky speaking. How can I help?
Yep, they'll be ready to collect after 4 tomorrow.
All right. Oh, bear with me. Hello? Would you like your daughter to come through?
Yes.
Yes, please.
She's my next of kin and she does everything for me.
Hello, how are you? Come in, take a seat.
Like an idiot, because I've just been swimming and I've gone completely deaf.
Oh no.
Well, not completely, but I've got one question while I'm here. I was sorting through my pill drawer, found this packet, which is only February, and I've no idea what they're for. I hope it's not something I should be taking.
I'll tell you. That's one I don't actually know.
I can't say it, that's for sure.
So nausea and vertigo?
Oh, I know what it is. I had a very strange giddy turn.
Yeah, there you go.
And my neighbours all thought I was having a stroke.
Oh,
I was talking strangely and...
Did it just suddenly come on?
Yeah, and I was trying to use my mobile to ring somebody and I couldn't sort of coordinate properly. Oh, I can't look at that.
And it was nausea and...
I'm just trying to think of the name of it. Gone from me as well.
Was it about your ears? Was it to do with your ears, the balance?
I think so, yes.
Labyrinthitis?
Yes, that's it. It was very frightening because when I couldn't use the phone and I was feeling unsteady and I'd thrown up all over my flat, but I got to the front door and the dustmen were just there and they were wonderful.
Oh.
They went down the road and got my friend for me.
Did it feel like you were on a boat?
Yeah.
That's the imbalance of the ears.
Yeah. And I wasn't speaking clear. Oh, God, that's all the signs for a stroke.
And of course, once you start to worry,
Yes.
that makes everything worse, doesn't it? But it's natural to worry. There you go.
Lovely.
All done.
Thank you very much.
Pleasure.
Now I'm killing time. I've heard yesterday that I've got an appointment at George's this afternoon.
Oh,
So I've
okay.
got an appointment at the skin clinic. So.
Oh, you getting around this
Yes,
week?
absolutely.
Nice to see you, always.
All the bits are being checked.
Take care. Bye-bye.
Yo, yo, yo.
Hi, Patrick. Come and have a seat. How are you?
Not great.
So it's been a while since I saw you.
I'm really feeling down. I'm feeling,
Yeah.
really suicidal. It scares me at the moment.
So I had a letter from A&E from a couple of weeks ago. What happened?
I ended up going to St. George's, which I got an initial assessment, and I waited for about 4 hours and basically discharged with 2 leaflets. Nothing
When anyone ever comes in and tells us about them feeling low or feeling down, it's really important to explore with them exactly how extensive those dark thoughts are. Are they just something that they've had a fleeting thought that would be a lot easier if you weren't alive? Or actually, is it more planned than that? Have they really thought through what they may do, and what steps have they taken to try that?
So had you done anything to actually hurt yourself, or was it just the kind of number of thoughts of it?
What happened is I started drinking and I knew that was dangerous, so I stopped drinking when I phoned, and it was the thoughts that where it would lead.
And how much are you drinking at the moment?
I'm sort of drinking every other day, and when I'm drinking it's probably about 6 cans of cider or 2 bottles of wine, that sort of drinking.
So that's kind of crept up quite a bit, hasn't it?
Yeah, from not drinking at all and slowly coming back to it. I mean, that's what scares me. If I'm depressed and I'm anxiety, if I put alcohol on top of it, it's dangerous. It's really, really dangerous.
You're seeing Dr. Sayer this morning. He'll see you up to 15 minutes late, so hopefully you'll be here, but I'll put him a little note.
How are you? Good morning, you all right? That's it.
I must stop coming in here because I was in yesterday.
Well, just bring your bed.
Any pain with it, or is it just more?
Yeah, it is. I mean, it is a bit painful. It's a bit of a joke in our house that it's a repetitive strain injury from fishing.
It might be a joke, but that's probably what's happened.
Right.
How often during the last year have you been unable to remember what happened the night before because you had been drinking?
Starting drinking again is a warning sign that, and it distorts everything, and then it brings in the depression and the anxiety, and then I don't know which is which. I don't know if it's alcohol related or am I using alcohol to solve it, but it's dangerous.
It goes hand in hand often, doesn't it?
Yeah.
So the drug and alcohol service, what help are they giving you at the moment, or what contact have you got with them?
I'm going to see them for an assessment. It's a drop-in, and they like you to turn up at least 3 times a week.
And how motivated do you feel about that at the moment?
I really, really have to do that.
Good.
Because, see, I'm isolated. I'm in my bedsit. I'm feeling sorry for myself. I'm getting depressed, and it's dangerous.
Okay.
Sometimes I just feel like, oh, what's the point?
Mhm.
It's just a game. But as you say, there's not a lot you can do right now. It's a slow process.
But it sounds like it's moving in the right direction in terms of the things that you're doing.
Yeah, and the medication I'm not even too sure, but I mean, medication doesn't work with alcohol, so...
No. So how much, you're having 150 at the moment, is that
Yeah.
right? Yeah. And you're still having it every day, or?
I'm still having it, but alcohol just neutralises it or something. I don't know what it does, but...
Yeah, so alcohol's a depressant, isn't it? So it kind of switch, I mean, there's no point in having an antidepressant
Yeah, when you've got a
if you're going to take a depressant as well. Yeah. So we know that you've got a lot of insight into things, don't you? You kind of know how things go. You've done this merry-go-round.
Yeah, the counselling, it seems to be going okay. It's something I've been looking for over a year.
Yeah.
And I finally got it, and if I finally got it, for Christ's sake, tell her what's going on.
Yeah.
Because I tend to tell people what I wish was going on. I convince people I'm actually okay.
Yeah.
This other woman from Ones With Mind, she's really helpful. She contacts me about once a week.
Okay, so that's extra support there.
Yeah, and it makes a difference. And
Good.
she's the one encouraging me, do this, and it's like somebody giving you a checklist, and it's so helpful, because you just do it.
Good.
Yeah.
Do as you're told.
Yeah.
All right, it's nice to see you, Patrick.
Okay, so that's everything. Okay.
Talk later.
And then-
Okay.
Cheers.
Bye.
Yeah, a half an hour appointment. And you say that you can never get hold of me. I'll give you half an hour of my liquid gold time and you're not even here. Oh, what? So 4 o'clock next Wednesday?
What's brought you in today?
Basically, I have been having like pain in one of my breasts.
Right.
And I wasn't sure what it could be, like what it could be basically. I'm probably like a little bit oversensitive anyway because my mum had breast cancer about 3 years ago, so it's something I kind of keep an eye out for.
What's happening with the pain?
It's not really, it's kind of just like a bit of an ache, and it feels like more like bruising.
Okay, and how long has it been there for?
About 3 weeks.
Okay.
It was kind of straight after my period and has carried on.
Okay, and are you on oral contraceptive or not? No.
No.
Okay. I wouldn't think much more of it at the moment
Okay.
in someone that is your age, is 24.
I was just really worried, I think, just because of
What
kind
happened?
of everything.
Yeah, understandable.
But I just
What
thought
age was she?
She's actually had cancer twice. So she
Of the
had,
breast twice? Or
no, she had a lymphoma when she was about 26.
God.
And then breast cancer recently, and she's about 47, I think.
Okay.
So, because it's kind of a pattern with her, like I recently have been, the last couple of years have been kind of a bit more.
And is there anyone else in the family that's had breast cancer?
Yes, one of my great aunts on my mum's side. So she got diagnosed shortly after my mum did. So,
okay,
yeah.
but she's a great aunt.
So she's my mum's aunt.
The mum's aunt.
Yeah.
Okay, yes, yeah, okay. So I always think it's quite a useful form. This is from Oxford University with their for their cancer genetics referrals. So if your mum had been diagnosed below the age of 40, one close relative, then we would be at that point we would be saying, well, actually maybe we'll do some genetic testing. And there's a couple of genes like the BRCA gene which are closely related to that. And often then you see, if someone's got a BRCA gene, probably there tends to be several people that have had problems. Right. So it might be somebody that presents very young, but there could also be 2 close relatives with breast cancer under the age of 60. So we're not sort of approaching any of these criteria. So we're not really thinking about increased risk. So I think that's hopefully quite a reassuring thing to think about.
That is very reassuring, yeah.
I think in general practice over the last few years, we've certainly seen a difference in the numbers of people presenting with very vague symptoms who are very concerned about significant underlying causes for this. There's so much coverage in the media of missed cancers and so much concern that any symptom could well be cancer. If you ended up with this sort of breast pain that was ongoing and it was coming from the breast tissue, then we would refer to a breast clinic at that point.
Okay, so just keep an eye on it, basically.
We would, yeah.
Okay, cool.
The real challenge in general practice is trying to identify the patients where those symptoms are important and we should be investigating them further. So yeah, I wouldn't worry too much about that, and then I'll just see how things go.
Yeah, okay, brilliant.
Okay.
Great, thank you very much.
No worries, take care. Have a good afternoon.
Thanks, you too.
Bye then.
$10:30, is that with Dr. Shah? All right then, take care.
All right
Bye.
then.
Hi. Are you showing the way to go?
Okay.
Yeah.
Thank you very much. Oops.
Who's this? Is this your...
No, it's my friend's
Your
grandson.
friend's grandson. All right. Angela suffers from high blood pressure and comes to see me regularly to monitor this and to get her blood pressure medication. On the last occasion, we also discussed her addiction problems, and we agreed she was going to go to the drug and alcohol support team to try and help with this.
I get the shakes, and I'm literally holding a can like that to drink it. I'm so sick of me. So sick of me.
Should we do your blood pressure? You've been taking your tablets?
Okay, yeah.
Yeah?
Yeah, absolutely. Come closer.
Blood pressure's great. Sorry to
Is
interrupt. I've never seen it so good. 119 over 78.
Oh, brilliant. Happy days.
So what happened then?
I broke it. I broke these bits. I can't remember. Sector cranium or something. What are you doing? Oh.
So what actually happened then? You were in a fight. Who was the fight with?
Doesn't matter.
Okay.
But the thing is, he punched me right here. It's gone down. But it was so that it was there. It's the lump is still there. I said, if you're going to X-ray me, X-ray my head, but they didn't. But I went after 3 days after the fact. It just got out of hand. He went like that, and that was it.
How much? So he punched you first?
He did, yeah, right, yeah. It's still there. It's still like it's going down, but it's still.
Yeah.
It was all over. It was all over. I even called the police.
You called the police?
Yeah.
And did they?
Because I took the knife and I went for him and I just thought, Angela, just leave. I ran with the knife and everything.
Okay. So where do we go from here? Did you ever go back to IDAS?
Of course, yeah. Oh, yeah. I'm still liaising with them. I've got an appointment. Of course. I need them. I can't do this on my own. I need you all.
Do you have a social worker through them? I ask you this all the time, but...
No, I still haven't. And I've not for want of trying. No. They didn't even bother with me. I don't know why.
And this, you're seeing someone,
Yeah.
is she like your caseworker? Or
She is.
Is she good?
It's very hard for me as a 44-year-old to deal with somebody who's in their 20s to tell me what. You know, it's embarrassing. I feel embarrassed. But
What kind of things do you talk to her? Is it focusing?
I don't talk to her about anything, to be quite honest.
Okay.
Yeah. She's too young. I can't work with her, to be quite honest with you. I've got children her age, man,
Yeah.
or a child, my daughter. It's not cool. I don't feel comfortable. I really don't.
I mean, you can say that. You can say it doesn't need to be a personal thing, but due to sort of age difference, it's not someone I feel...
Isn't that not age discrimination?
No. It's completely within...
Ageism, is that what they call it?
Yeah, but I think it's fine. So it has to be somebody that you feel you can speak to and can help you.
I'd rather somebody else I could speak to.
I'm going to try and just speak to them at IAPT as well about this. If you can give this, I've just put it together with the appointment. This is a letter. If you can give that on Thursday.
Yeah.
If you want to ask for someone different, that's up to you. I haven't said anything. I don't want to compromise. I'll give you 3 months of your blood pressure tablets.
Yeah,
Make it awkward
I
when you see
appreciate
her.
that.
Okay. There's the prescriptions, months of each of these. Okay.
Come, let's go. We'll get some outside. Thank you.
Fine. Well done. I will
Thank
see you. That's
Thank you very
fine.
much.
Blood pressure's very good, and we'll
yeah.
see. I'll try and speak to IAPT and see what they say.
Thank you.
Okay.
कैसे सब इकट्ठे करेंगे
Hi, I'm Sean with the doctors. I'm good, come in. What can I do? I'm good, thank you, yes.
Excellent.
What can I do for you?
Well, my wife and I are trying to have a baby.
Yeah.
And she's come in, she's a member of the same place as well. And
Yeah.
we've been trying for a little while now.
Yeah.
I know that we're in our mid-30s, so we wanted just to kind of like see, I don't know, maybe have a test to see how we're going. And, you know, I think she's already kind of had the first stage of testing done.
Okay.
And so that was just what we were kind of like hoping for. So, yeah.
Fine. How long have you been trying for now?
I would say probably we tried a little while ago, and it's probably been about 6 to 9 months now we've been trying for.
Okay.
So, yeah. Just getting a little bit of concern in place now because we've been trying to follow a schedule, see how it works, and nothing's really taken flight yet. So.
Okay, fine. And then she's come off the pill again, or?
Oh no, she never went back on.
She never went back on it.
No.
I see. So you just stopped using condoms, or?
Yeah. That's it. Yeah.
Yeah. Okay. And how often are you having sex?
I'd say probably, I don't know, maybe like over the period, kind of like the window that we're given. You know, we have one of those apps on your phone, so we have like a 4 or 5 day period or whatever.
Yeah.
So we probably have like sex at least once a day over those times.
Okay.
And then in between, probably, I don't know, maybe 2 or 3 times.
A week?
Yeah. I know, probably in between the time. Because of work and everything, it's hard to find the time. We try, but
so 2 to 3 times
the
outside
other 2
of the
weeks,
fertile window.
Yeah, that's it, yeah.
And what's your lifestyle like in terms of, don't look overweight?
No, thanks. Oh, I try and work out. I exercise. I play football once a week and go to the gym as well.
What about smoking?
No, I used to smoke, but I gave up about 6 months ago.
And alcohol?
I'm not a big drinker. Maybe like 4 drinks per week. I would say something along those kind of lines.
Yeah, not excessive at all. So there's probably not much you can do lifestyle-wise, because you're already leading a pretty healthy lifestyle, really, aren't you?
Thanks.
Okay.
Yeah, no, I tried to, definitely.
Yeah, OK. Let's get a semen analysis done for you, OK? And then we can see what that shows. You know, the majority of people will get pregnant. You know, so sometimes it's just a matter of time. You know, if we can't find a problem, let's just keep having sex and it should happen.
Of course.
You know, probability-wise, even in your age group, you know, sometimes it even take longer than a year. But I think, you know, we would potentially refer you in another 6 months if you weren't getting anywhere unless we found a problem.
I've been coughing for weeks and weeks and weeks, and I've been given an antibiotic. It's not working.
Are you breathless?
I feel a bit breathless, yeah. And in the mornings, it's really, really nice. I've got really thick green phlegm, and sometimes it has blood in it.
It's just not going away. We've got to the stage where I like to get it checked out. Exactly.
Make some noise. Oh, the roar was good. The roar was good, but actually the singing was better, and we got to see right to the back of the throat.
I mean, they're all for the chest. The one you had is actually for the chest. I think the fact that you've had an antibiotic and you're still coughing, we need to do a chest X-ray to see what's going on with your lungs.
It looks absolutely perfect at the back. So she's looking good.
Hi, Sheila. Hi, come on in. Come and have a seat.
Thank you.
Right, I'm Dr. Beecraft. How can I help?
First of all, I had this this cough going on for a week now, and yeah, I know it's probably you've heard loads of people going on and on about their coughs, etc. But like I say, it's keeping me up all night. Can you give me some antibiotics for that?
Fine, let's have a see. So, are you a smoker?
Yes.
How much do you smoke?
About, I don't know, 6 cigarettes a day.
Okay.
Yeah.
And is that something you've done for a long time?
Yeah.
Yeah, okay. And what are your thoughts about your smoking?
I don't have any thoughts about my smoking.
Do you think it's a good thing or a bad thing? Or?
It's not making me cough.
Okay.
It's something else making me cough.
Let's have a little look. Just pop that on your finger. And what is it you do for work?
I'm not working at the moment.
Okay. Right, well done. Slip that off. And can I get you to stand up and we can have a little listen to your chest? So nice, big, deep breaths in and out for me. Okay. Right. You have got some extra noise in your chest, so yes, I think you do need some antibiotics. I was just looking at your notes before you came in and saw that actually we never see you very often, but when we do, it was kind of about a similar thing back in December. My worry is you're getting these chest infections relatively regularly, and that's probably related to the smoking. When you're younger, you smoke and it doesn't really affect you, but over time, it will start to build up, and this is often what the pattern we see is people then start to get ill more quickly.
Okay.
So I think we need to be a bit careful about your smoking.
Okay, I'll quit then.
Have you ever tried to quit before?
Yeah, I think I've quit for a couple of years before, and well, I have, it's part of my sort of my morning thing. I have a roll up in the garden. Yeah, I'll work on that. I mean,
because we've got some of our nurses here do kind of a stop smoking kind of session.
Yeah, and I think it's about you deciding to do it. Really,
yeah,
it's
so it's
the
kind of
main thing.
motivation. I think is coming from
Uh-huh.
you. But okay, I'm sorry, 3 times a day for a week.
Yes.
And then leave it a few weeks and then come back and see me.
Right.
And make it a double appointment.
Yes.
Okay.
Okay.
All right. Take care then.
Cheers.
Bye.
Hello. How are you?
I need to pee. Erin. I'm gonna go.
I'm so tired. Oh, I'm totally broken.
Really?
I had one of those big pints of Red Bull, so I'm going to go and have another one of those.
Pro Plus?
Okay. Red Bull.
Onwards.
You get in there, sit it.
See ya.
The only thing is, sometimes if you have sex too much, your semen quality goes down.
Okay.
So potentially I would say during that fertile period is perhaps not have sex so much.
Okay, all right.
So probably 2 or 3 times a week
Okay.
consistently is probably better
Yeah.
than every day during that
Okay.
fertile period. Yeah. Let me get a semen pack for you. So this is the pot. So no ejaculation for 2 to 7 days, okay? Wash your hands, obviously, no lubricants. You masturbate into here, okay? And you need to collect all of the ejaculate, okay? Name, date and time on the bottle.
Okay.
And then you need to get it to the pathology lab within an hour of doing the sample.
Okay,
This is the
all
tricky
right.
bit.
Yeah, okay.
The other problem is that the hospital is not the local hospital.
Oh, okay, all right.
Logistically, you've got to think if that's possible.
Quickly.
Okay?
I've got a car, so...
If it's not possible, okay,
Yeah.
then they can arrange for you to have a room in the hospital.
Okay, yeah,
to masturbate in, okay? But you need to book
Everybody's
that, pre-book that room, okay?
All right, no
I don't
worries.
think a horrible hospital room is be very pleasant, but you'll just have to think how long it's going to take you to get there, what time you go.
Okay.
And keep it warm, okay, in your
Yeah.
pocket. Okay?
Okay, all right, no worries. All right.
Tray. Okay?
No worries.
And then we'll find out. Hopefully it'll be fine.
Okay, all right.
Good luck, okay?
Well, thank you very much. Appreciate it.
And we'll get the result, and then you can give me a call for the results, okay?
Okay.
Once you've done it.
Cool. Wonderful. Thank you very much for
all
your help.
right.
Appreciate it.
Bye-bye.
Well, I might still be here, but I finish at 7, so you might just catch me on the way out.
Okay.
Thank you
No,
very
it's all right.
much.
It's all right for you. You can jump up like a whippet.
Thank you, Doctor.
Okay.
Good. All right. Take care. Bye.
Go on.
She does.
Very good.
Good girl.
All right, take it easy.
I love working this surgery because I think every day is different.
There is no God anymore.
Mary, don't give up your faith, okay?
The best thing about being a GP is making a difference in people's everyday lives. Okay, sorry, I might have just ruined your hair.
It's fine.
Patients here are fantastic. They keep you on your toes.
Don't think I'm that crazy, yeah? I'm not into that stage anymore. Don't make me a psycho.
I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters, and a great grandson. If I died tomorrow, I ain't got no complaints.
Hello, Fanamo Surgery. We need to speak. How can I help?
Come in, Mary.
What are you doing down here?
I've been sent into, it's like being sent to Coventry. So I'm looking at your finger again, is that right? Which one is it? That's a giveaway,
The
isn't it?
morning is the worst time. I would like to give you praise because to me you're not David Ward, you're St. David.
Okay, well, that's very kind of you to say that. But I think the saints may feel that they're being reduced in stature if I'm elevated to that level.
You're in my estimation anyway, you are. That's my opinion of you.
Well, that's very kind of you to say that. Now, listen, Yeah, you've had one on each hand. Are you happy for me to do it again?
I'm happy with you to go ahead. I'm going to leave it till last. But I'm going to tell you now, you know the x-ray you sent me for?
Yeah.
He was kind enough to refer me to Exon Park.
Okay, yes.
Because his words to me were that it's 8 years since I've had the tumour removed.
Okay.
And his words to me were that it could...
Keep talking, I'm just going to get this ready. Yeah, keep talking.
It could be the cancer come back, but it had gone to my bones. And I went in and I seen Dr. Hale. She introduced herself and she said, I'm a cancer doctor.
That's very good service, isn't it?
So she said, it's very unlikely that it's cancer.
Yep.
But she wants those bloods and the MRI done before I see her next week.
Yep.
I mean, okay, I'm lucky. It's 8 years since I had it.
Yep.
I didn't even have to have chemo.
No, that's right.
Do you know what? My oldest son, he turned around and he said to me, there is no God anymore.
Well.
And I said, you know, Tony, I'm having second thoughts.
Mary, don't give up your faith, okay?
You bought chocolate? Always. Oh, I love you. Bit of chocolate in the morning never hurt anyone.
Diamantino Pereira. Hiya.
My problem is, for my age, I am missing quite a lot of hair.
Okay, so when you say you're missing quite a lot of hair, what do you mean?
There's a lot of hair is missing a lot since more than 1 year.
Is it only when you brush it and wash it, or is it just falling out? You're noticing that it's just...
No, it's just falling out sometimes when I do this. Just put my hair straight.
Sure.
3, 4 come on my hands.
Okay.
Every time.
Okay.
And it's quite nerve-wracking, you know.
Okay. So any ideas what you might think is going on?
I got a depression from the school.
What?
Depression,
okay.
yeah, from school. You take medication too.
Okay. Any family history of sort of hair loss or what we call vitiligo with the...
My dad, the back, but...
Okay. Oh, is your dad a bit older now?
Right now, I just touched it and one came in one hand.
Okay. Hair loss is not very common in teenage boys. However, it can occur in some situations. The most common cause of hair loss is male pattern baldness. This can actually start developing after puberty in late teens, early 20s. Other causes are alopecia areata, psychological emotional stress, thyroid conditions, hairstyling and treatments. Can I just have a look at your hair, first of all, see what's going on here? Okay, so you don't have any specific patches where it's all kind of come out in one sort of bulk, but yeah, it's a little bit thin in some areas. Okay, sorry, I might have just ruined your hair.
It's fine.
Okay, so I think sometimes if you're low in iron, that can cause you to have sort of hair loss. And yes, sometimes stress can have an effect on it, okay? And sometimes it's just one of those things, you know, the hair grows in cycles, and sometimes it just means that the cycle is all at the same time, so it appears that more's falling out than normal. But the first thing we would want to check is sort of iron levels and see if that's a possibility, because like you said, you're growing, so it may just be like that. What's your diet like?
Diet, yeah. Salad, fruit, yeah.
We eat a lot of salad.
Yeah, I'm not a very normal kid. I like healthy stuff.
Okay, so your diet seems like it's good, but you are growing, so sometimes these things can happen. And are you particularly stressed at the moment?
No, not really, no.
Got exams or anything?
No, when
what year are you
have sometimes...
Year 10.
Okay, so first year GCSE, so the stress is coming next year. Yeah. Okay, all right. So let's do some blood tests, and then we'll see what the results of that come back, and then we'll have a chat about it, okay?
Okay, let's go do it.
All right, bye-bye.
Thank you.
Let's go.
So appointment for Musa?
Yes,
Yeah.
please.
How can I help?
Since yesterday, he had cough and flu, and then high temperature.
Okay.
So I gave him Nurofen. It didn't work, and he just kept crying. Yeah.
Has he had a messy nappy?
Yesterday he did, yes, but after that last whole night now.
Okay.
One thing which I felt that he's breathing not well because he's forcing something like when he was breathing.
Okay. And no rashes at all?
No.
Hello, you. Hello. Who's this strange man? Hey? Got really long eyelashes, isn't he? Oh, you're not a very happy bunny, are you? You're not. Oh, okay. So, Mum, when I'm having a look at his chest, I can see what you mean. He really is struggling with the breathing, actually.
Yeah.
So he's sucking in underneath his rib every time he's breathing in. So it may be that there's an infection in the lung. Because the breathing is quite rapid, I'm not really happy to leave it like this.
So I'm going to reach about 110, am I?
Oh, at least. At least.
My mum always said, better the devil you know. You know, I wish I'd have never given up smoking. I'd have been better off.
I don't know about that. Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and joy. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. You'd be better off without the biscuits.
Mary, don't give up your faith.
Why is it all happening?
I can't answer that.
No, you can't.
I can't answer
There is no answer.
All we can do is try our best. Mary has had an episode of cancer a number of years ago. She had a bowel cancer, which had to be removed. She's one of the most stoic people I think I've ever met. She never complains about herself, and she's always concerned more about other people rather than herself. Whether you are a believer or not, I think people do better when they feel that there is somebody out there that may be helping their lives. I'm not a huge believer myself, but I've seen how people can get support. And I think, you know, places like churches or mosques or synagogues, whatever the faith is, are able to provide a great deal of support, particularly in trying times. And I think that's why she needs to stay with it. Now, spin around a little bit more and pop that hand up here. That's good. Let's pop that out
Now, I
here.
know this is going to hurt.
Right. Now, listen.
And I'm sure you love doing it.
Not quite as saint-like as you thought then.
You are a saint. You are a wonderful gentleman.
OK, Mary, try and hold as still as you can. I'm sorry about that. Well done. Well done.
Do you know what? The liquid going in hurts more than the needle.
Probably. What I might do is see if I can get you back in again in a couple of weeks, maybe, yeah? And then we can see how that's gone, yeah?
Yeah. And talking of my health, why don't you write to your people in Australia and tell them to send a sack full of nice weather over here?
What are people going to do if they can't complain about the weather? It's a national pastime, Mary.
It's now nature, I presume. So thank you so very, very much for seeing me again. I know I'm a nuisance. I won't swear.
Oh, Mary. Let's see how you get on, hey? And I'll see you on the 15th.
Thank you. And you are still St. David. You definitely are.
OK, Mary.
Thank you.
Bye-bye then. Bye.
Hi, could you do the paediatric reg on call, please, for a referral? It's one of the GPs in Slough. Thank you. Oh, hi, my name's Amit. I'm one of the GP regs in Slough. Hi, I've got a baby that I'm a bit concerned about. It's 16-week-old boy, Musa Syed. My main concern is that he's febrile at 38.1 with a respiratory rate of between 60 and 70, and there is subcostal recession and some crackles at the right base. Yeah, blood, sure. Sure. Okay, thank you, bye. Okay. So that was the paediatric doctor, so they're happy. Are you okay?
Yeah.
It's all right. Look, the paediatric doctor did say that usually, in most cases, this is a virus that causes difficulty in the airways, okay? And typically babies get better with this, okay, after some observation. But obviously we're just being careful because the breathing rate's quite fast and because he seems to be working quite hard.
Yeah.
He may well need to have some blood tests just to make sure there aren't any serious signs of infection, okay? But if those are all normal and baby improves, then you may be able to go home today, okay? So, you know, I can understand it's worrying, but, you know, they'll take good care of him and do what's necessary. Okay.
Thank you very much. Okay.
Take a seat through in the waiting room.
I'll give it to you in a minute.
Just through there.
How are you today?
Basically, my ankle and my leg, believe it or not, keeps swelling up so bad I'm in pain in my thigh, the back of my leg and my back. Now, I know I've got type 2 diabetes and they keep checking my ankles and feet to make sure the blood's flowing for. It's constantly swelling up.
But this swelling, is it something new or recent?
No, I've had it for years.
What was the trigger why you came today?
It's getting to the pain now that I can hardly walk on it.
Okay. What about the left leg? Is
Left
okay?
leg's fine.
So let's do a little check now today, quick check on your legs. Any pain when I press there?
No.
That hurts?
Yeah.
And when I move the...
I can only go up and down.
Up and down, yeah.
That's fine.
Any pain there?
Not at the moment.
Okay.
Do you want me to put these back on now?
Yes.
I wasn't expecting to come straight round here, to be honest with you.
Okay. So clearly, a certain amount of retention of the fluid is allowed, especially if you had a previous surgery or fusion surgery and everything. Do you smoke?
I do smoke, yeah.
How much do you smoke?
All depends, to be quite honest with you. Sometimes, if I'm bored, I would say roughly between 20 and 30 in a night.
So you do know that the smoking is injurious to health?
Yes, after all these years, I think so, yeah.
How many years have you smoked?
I've been smoking since I was about 11.
Okay. Smoking is injurious to health. It can cause cancer, lung cancer and issues like that. Yeah.
I'm not being disrespectful to anybody. I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters and a great grandson. If I died tomorrow, I ain't got no complaints.
Okay. So help is available once you're ready to quit. But you have mentioned what you've mentioned now. So we'll have to just leave it there, but also please be sort of aware that there's an offer there.
Yeah, I understand, yeah.
As a first thing, I would recommend or advise that we get an X-ray done and look at options of whether you need to be further seen by the orthopedic doctors. So you can walk in between 8 o'clock in the morning to 8 o'clock in the evening to Wexham Park Hospital on any of the weekdays.
Oh, great stuff. That's even better.
It's a walk-in service, yeah.
So I can actually just walk in there?
Just walk in and say, my doctor has ordered the X-ray online in his GP clinical system.
Dr. Lee, yeah?
Dr. Nanda, myself. Okay?
Cheers.
All right,
Thank you very much indeed.
All the best.
Yeah, and you, my friend. Take it easy.
Bye-bye.
Cheers.
Bye.
Ta-ra.
Hiya.
Hi, ladies, all right?
Good, thank you. How are you?
Yeah, don't look it up, like, you know, just sit there, you know.
We've got work to
Your
do.
cup of tea, like, you know.
We've got work to do.
Alana Burnett Thomas. Hello, come on through. You all right?
Yeah, you okay?
Is it that pesky nose of yours, is it again?
I know. She has them 4 or 5 times a day. Last night she had one for about 40 minutes. The school
Oh.
phoned me today.
Yeah.
So it started at 9 and...
It like ended after assembly.
Did it?
So,
How long's
yeah.
assembly?
Like 20 minutes.
Oh my goodness, that did go on a bit, didn't it?
So I was just lining up from Breakfast Club and I was just about to go and then it was just dripping.
And is
when I was
it
walking
that
onto
right
the
nostril
playground.
or is that
This
side?
one, yeah.
And what do you do when it starts? Do you pinch your nose? Brilliant,
Yeah.
good girl.
I think the teacher helped because it went on from 9 till 11.
Yeah.
Through the assembly, I think the teacher pinched onto it for about 15 minutes.
For like
yeah.
Any signs of tiredness or anything like that? Are you concerned in any way?
I don't think so, no.
And is it a lot that she's losing? Can I have a little peek up your nose? Is that all right? Okay, Poppy, so I'm just going to let you put that at the edge of your nose. It's going to go in a little bit. Is that okay? Good girl. Yes, you can see it's at the bottom of the nostril, right at the back.
Right.
Where it is. You've obviously got a weak vessel there.
Okay. That's what my teacher keeps on saying. She says that I've got a weak vessel
Is she
and they
worse when
keep
she
on
gets hot?
bursting. She says, sit in the shade and stop running around.
Yeah, because if you get a bit hot
Yeah, of
dilated,
course,
that
yeah.
can do it.
Yeah.
But it's still got to be looked into,
Yeah,
really,
okay.
for her.
No problem.
Does she ever vomit as well? Because it trickles into the back of the throat.
Yeah. This is what's really upsetting her.
If you are sick, shall I tell you why it's happening? When the blood trickles down into your tummy, your tummy doesn't like it being in there. So because it doesn't like the blood, it makes you sick to get rid of it. So literally every day it happens.
Yeah. Not just once either. How many do you have at school? You have a couple at school and then a couple at home, don't you?
Yeah.
It's 4 times. And it is every
But
single
like
day.
this whole week I've had no
Since September. By Wednesday,
Yeah.
phone in
Okay.
and just see if there's an update
Yeah.
at all with the referral and we can see what's going on. Does that
Yeah, I
sound
appreciate
okay with
that.
you?
Yeah, that's lovely.
Brilliant.
Okay then,
All
thank
right,
you very
take
much for
care. I'm
seeing
sorry
us.
you're going through this. Look after yourself. Bye-bye.
How do people get through life without being able to read or write? Like how do they pass their driving test?
She probably doesn't drive.
How can I help, David?
An incident happened and I got an injury on my eye. I woke up this morning and it was really hurting and watering.
Okay, and what happened? You got a punch to the face?
Yeah.
Okay.
It was swollen and you can see there's a cut underneath where they've glued it.
Okay, I've looked at the letter. It says the CT scan didn't show a fracture or anything, you know, of the orbital, so that's the bones around the eye. And they said that the scan in the brain didn't show a bleed or anything, so they obviously discharged you. And did you lose any consciousness when it happened?
For a couple of minutes, yes.
Since Saturday, have you had any vomiting?
No.
Any double vision?
It's a bit blurry, that's about it.
Just switch this light on. Look down for me. Is that hurting?
Yeah.
Okay, I'm just going to have a look. So this pupil's contracting quicker than this one. It's still narrowing, but not as much as the other eye. So I think looking at the eye and the health of the eye and your symptoms, I don't think there's anything too nasty going on, but in case there's a scratch on the surface of the eye and the fact that your eye's now watering and the pain's getting slightly worse does concern me. You need to get the eye looked at properly. And when you tell them what's going on, they should hopefully see you straight away.
What I need to do today is just examine the knees.
Yeah.
Does that cause you pain when I'm bending it?
Discomfort, that's not pain.
That's fine. Put your things back on. Okay. So it's difficult to say what's causing your pain at the moment. When I'm moving your knee, it's got a good range of movement actually. So I think a first point of call would be an X-ray. That we can arrange that. Usually takes about a week for us to get the report.
That's fine.
Yeah. In the meantime, how do you feel about some physiotherapy maybe?
As long as it stops it hurting, I don't know.
Now, if any symptoms, if you ever get it sort of locking in a straight position like that and it gets stuck, or the giving way gets worse, obviously come back and see us.
There was one other thing I wanted to talk.
I've been getting angry very quick recently. My wife's noticed it a lot. I did have depression a while back. I just don't want it coming back, if you know what I mean. And this seems to be a thing that happens.
Okay.
I needed to not talk to someone, but mention it, because I don't like the way it's going, to be fair.
I can see you look quite anxious.
Yeah.
And how long has this been sort of affecting you for more recently?
A few months. It hasn't helped. I lost my dad last month.
I'm sorry to hear that.
But I haven't been sleeping very well either. So I don't know. But it's been going on for a couple of months. And then with that, it's just...
Okay, it's kind of made things a bit worse, presumably. Okay. And who else is at home with you? Is it just yourself and your wife? Was your father's passing, was it expected or was it...
No, unexpected.
No.
But that isn't what's caused this.
No, you know, things were going on
it's been going on for a while.
Yeah. And have you identified any things that could have made things worse over the last few months?
Not that I can think of, it's just me.
How are things at work?
Yeah, okay. Good.
And things between yourself and your wife otherwise?
Yeah, fine.
Yeah.
Yeah, we're good.
Yeah, okay.
I just don't know what it is.
Do you feel low in yourself?
Sometimes.
Yeah.
At the moment, I feel quite bruised, almost like someone's taken my ovary out and punched it a few times and put it back in. It's really sore.
And what's happening is that when I'm urinating, I'm getting a lot of... It feels as if I've been getting a stitch.
2 weeks ago, I took all this paracetamol with codeine. It was worse. It was like a drug for me.
When I'm coughing, it really burns. Like, it feels like a mini explosion inside my chest.
It's very sore down there on the right, isn't it? I know you said you've had this sort of pain before. It's in the right place for your appendix. I know you haven't got a temperature, but you are guarding in that area. So I think I need to ask someone to see at the hospital today just to check.
Do you ever get any harmful thoughts?
I have, but not to the point where, you know, I've sort of, don't be so stupid to myself kind of thing. You know, it's the thought. It's a thought, then it's dismissed. Yeah.
So no specific plans to happen?
Oh no.
Okay.
Definitely not.
Had you had a thought as to what you might want to do to try and start improving things?
I don't know. My freedom was going out on my bike.
Okay.
I can't do it.
No, because of your pain.
I'm not allowed to do it.
Yeah. So, I mean, there's a few options, and I think it largely depends on how you want to kind of approach things now. You were on medications before, and that's one of the ways in which we try and help people who are suffering with symptoms of depression, but that really just kind of, it's not a cure as such. It can try and control the symptoms, but really to get to the root of things, we often recommend counselling as one option. It's called talking therapies in this area, but essentially it's a form of counselling.
Yeah.
Have you ever had something like that before?
I haven't, and to be fair, I don't feel comfortable doing that.
Yeah. Okay.
I don't talk.
Yeah. I mean, what we can do is start you on a tablet again for your mood.
Okay.
Okay. Something called sertraline.
All right.
Very similar to citalopram. Typically, things can get a bit worse for the first sort of week or so being on the medication, but then, generally speaking, after the first month, you should hopefully, if you're going to see improvements, you start seeing them.
Okay.
How does that sound? Would you want to consider that?
I'll try it and see what happens.
And then maybe we can see you again in a couple of weeks' time, see how things are getting on.
Okay.
Yeah? All right.
Thank you very much, sir.
Okay.
Cheers.
No problem. Take care.
I have the 16th.
was wondering if I can see someone to get wax taken out of my ear because I'm having problems
Are you
hearing.
patient in surgery?
Sorry?
Are you patient in the surgery?
Well, I'm from Australia. No.
From Australia. What you can do, you can go to the walk-in centre. That's the address it is. It's in the high street. Because they'll probably tell you to put drops in your ears, just loosen the wax anyway.
Surely someone can do that because I'm flying on the plane.
I know, but you can't get it done here because first of all, you're not registered.
It takes 10 minutes.
I know. That's the only people who can help you if you want the number.
This
okay?
is stupid.
Well, it's not stupid because you're not registered here.
Well, it's like the World Cup final, isn't it? What happened there? You know, we finally managed to come back a little bit, and then they just knew how to put the foot on the accelerator. So you're not doing well, mate, according to this essay that I can see in here.
I just don't know where I'm going. I'm so...
Why? What's happened?
Oh, I've got loads
differently.
of things. I've got loads of things going on in my life at the moment. 3 weeks ago, yeah, he actually attacked me. That's my wrist up, yeah? Okay? I got arrested for assault. I'm out on bail for ABH. Yeah, I've got 2 witnesses who said he's attacked me, but I haven't even questioned them. I mean, all this is just... And then I get home on Sunday, got a letter from a copper, we need to speak to you. So I phoned them up, they said, oh, your dog's been reported for attacking people and children. We need to sort it out. And I started losing my... Because I just started losing it big time, yeah? And I just left the phone on and walked away, yeah? Because I just couldn't answer it, yeah? I just could not answer the question.
I've known David for many, many years. He has a number of problems that were going on, one of which was a fall whilst having an altercation, which led to an injury, and he ended up having to go and have an X-ray. So 2 problems. Firstly, the wrist and his pain, but secondly, the altercation and what came after that, which is affecting him quite badly.
Yeah, it's just constantly, yeah. And I mean, Sunday, yeah, I just lost it big time. And I literally got home and I had my drugs out and everything, and I was quite happy just to end it all because it's just at the moment no one seems to be giving a. Well, I'm sorry about the language, but that's how I am really.
I can understand how you feel because not many people have that many things going on at the same time, do they? Do you know what I mean? You've had this and this and this and this and this, and they're all getting on top of you to the point where you're at breaking point. 2 things. Okay. Firstly, I want to get you back next week and see how you're getting on. Okay.
Yeah.
Now, I don't have a miracle for you. I can't change all of those things for you.
No, I know.
Do you know what I mean? But I can listen to you and I can agree with you, and we can talk about ways forward that you might be able to take to try and help this out.
This wrist, hang on. There was a letter sent to you, but I know you don't. Or you don't read it, one of the 2. About this wrist, yeah. One consultant is saying it's broken. The other one saying it's not. I'm in absolute agony with it, yeah? I'm in absolute agony with it, especially around this area.
Okay, we need to X-ray that again. Because your pain is down in here, in that area there.
Yeah, it's all...
Okay, so if I press in there, so this is what we call your...
right,
so it doesn't matter
right
what it's
around
called.
this area is really...
But you've got a little bone under here that if you break that bone, then you can run into real trouble, okay?
I mean...
The difficulty is that it doesn't always show up straight away on X-ray.
I mean, the bruising's gone down a hell of a lot, yeah? And it wasn't any...
So you are sore in there, aren't you?
Yeah.
Okay, so we
wasn't
re-X-ray.
any swelling as such.
What I want to do, okay, so there's 2 bits to this, okay? I've organised an X-ray for that, okay? You need to go tomorrow to Wexham, okay?
Yeah.
Between 8 a.m. and 8 p.m.
Yeah. No.
Okay, they will do special views to try and look at that bone, okay? We're going to continue this conversation next week.
Yeah.
Okay,
well,
mate.
This is the problem.
This...
I know you only got a short time to see me, yeah? And, I mean... Sorry, yeah, I know. But, yeah, I mean, I know...
Look, I understand, mate, and I understand your frustration, and I understand how you're feeling.
Yeah.
And I understand exactly what it is. This is to try and help you sleep a little bit at night.
All right.
Okay, 2 in the evening. They're not addictive or anything like that. Their side effect is that makes you sleepy. It's no guarantee, but it might help a little bit, and next week you can tell me how you're getting on with them.
All right.
Okay, mate. Look, we'll have a chat next week, okay? Yeah.
But I have no family I can actually go and speak to. I might go on a Jeremy Kyle show and be an idiot here like all the rest. They always seem to be on benefits and... Yeah, we walk on stage and they're supposed to be on disability benefit. Yeah.
But if you go on Jeremy Kyle, you'll end up punching somebody, won't you?
Yeah, but
and that'll be all over, and then you'll be back in front of the police station.
Yeah, so I just... Thanks, okay.
Cheers, mate.
Road Surgery. You've been to Pam. How can I help? Oh, hello.
How can I help you?
I was diagnosed with anorexia nervosa, and so I was in and out of food disorder clinics and things like that, and so they said to go for a bone scan just to check on things, and it was found that my bone density was quite low. I was told that I had early onset osteoporosis then. I was told that a follow-up scan would need to be done 2 years later, so that would have been 2012, and I've still not had it done yet.
All right.
And I was kind of worrying because, like, when I get up, mostly in the mornings, like, I really ache. It takes me a while to be able to get out of bed, and I'm just worried about, like, as I get older with osteoporosis now, that it's going to affect me more.
How old were you in that time?
14, 15.
14. And now since then, are you eating all right?
Better, yeah.
All
Much
right.
better.
You look happy.
Yeah.
All right. Okay.
A lot healthier than I was.
And how is your weight doing?
Good, I think.
You put on weight?
Yeah.
Okay. And how about your periods?
Good.
Yeah.
Fine, absolutely
Passing, urine, bowels.
Yeah.
And you mentioned this joint pains, or is it just one pain?
Just general aches and pains. More so when I'm active, like if I'm doing a lot of walking. I play football quite a bit. So more so then I ache a lot after, whereas like normally someone might ache a bit after the gym, like I ache thoroughly after the gym.
Are you on any medication on a regular basis?
Not now, no.
Like steroids or anything like that?
No, nothing like that. Never have
All right. Okay. And what do you do? Do you work or are you studying at the moment?
I'm an SEN teaching assistant at the moment.
All right. How is that going on?
Great.
Okay. All right. So basically, you want to make sure that you have a scan and that you don't have osteoporosis or is it not progressed?
It's not progressed and got worse.
All right. Okay. Now have a quick look at the notes if that's okay with you. Were you given some vitamin D tablets and things as well at the time?
Yeah, I was given Adcal D3.
Mm-hmm. So your BMI is okay at the moment, but I think it should be okay to organize a scan. The reason why I was doing is because there are certain criteria you need to meet for a scan, and sometimes they reject it. All right, so that's done.
Okay, thank you.
Okay. Obviously, if you don't hear from them in 2 to 3 weeks' time, just ring the secretaries to find out if the form has been anywhere declined or anything. Yeah? Okay?
Thank you.
All right. Yeah.
Daniel Zaloga, please. Okay, how are things?
Yeah, I come down with it. I've got a small problem. Actually, it's a habit. I do smoke ganja for a couple of years now, and it came to that stage. It started ruining my life, relationship, and stuff like that. I end up in police station.
I called the police.
Yeah, my mum rang police because
I called police because
I lost the control of my brain and body.
What happened?
in the morning on Friday, he called to me and he told me I killed myself, blah, blah, blah. You see one person, inside is two guys. One is good, one is bad. Sometimes he don't have a control of himself.
It's not that I don't control, I just got short
Daniel
temper.
don't have a control because he is a little bit angry.
How do you feel about this? I mean, would you say that's true?
Yeah, that's sort of a true. When I've got a short temper, I'm not gonna say I have got short temper.
Okay.
He needs help, you know.
Yeah, I need some sort of medication to come off from marijuana.
Daniel was a 23-year-old guy that I saw with his mum. I've seen quite a few patients now in their early 20s who come with parents or girlfriends. I think it's quite common now, and actually for me as a GP, it gives me quite a nice insight to speak to a relative as well. It gives me an idea of how cannabis use is actually affecting other people in their lives. How long have you been smoking marijuana for?
Oh my gosh, my friend, I've been smoking for
Around 8 years.
8 years now.
He smoked around 15 joints a day.
15, so over 3.5 grams in a day. I'm even reaching 5 grams in a day.
Okay. And apart from marijuana, any other drugs that you take? Or any tablets or any injecting? No? Okay. Do you drink alcohol?
Once in a blue moon.
Once in a blue
Like
okay.
everyone.
Okay. Do you ever, just a few other questions about your mental health. Do you ever see or hear things that aren't there? Anything like that? Nothing like that?
Okay. Get to that level.
At the moment, maybe no. At the moment.
Yeah.
He have it after, so you know, like
And
he's...
You mentioned.
No, listen. Don't think I'm that crazy, yeah? I'm not into that stage anymore. I'm not in that. I've never been in that stage. Yeah? Don't make me a cycle because I know where I am. It's just a bad habit. So don't chat shit, yeah? You understand? Don't talk shit because I don't like it.
So, Chris, can I call you Chris?
Yes, please do. Yeah.
Okay, Terence is my name.
Okay.
I've got a big heart.
Oh, I
Believe
bet.
me, I've got a
I
really
bet.
big heart.
Oh, thank you.
You're
Thank you for doing that.
You're welcome.
Thank you very much.
All right, take care. All right, take care. Bye-bye.
Don't talk shit because I don't like it.
Okay, let's bring this back to your symptoms, okay? Yeah. So, apart from the anger, you've mentioned on one occasion you rang your mum. You said you felt like ending your life. Do you remember having that conversation?
I didn't kill myself. I said I'm gonna kill someone else. That's the reason I end up in police station and.
Okay. Do you feel like that a lot? Do you feel like you have a lot of anger? Do you feel that you're likely to harm other people?
Yeah. I quickly get angry. I lose my temper quickly.
Okay. So here's the thing. We know that smoking marijuana as regularly as you are doing definitely has mental health side effects. Yeah. Okay. So I think there's a lot of evidence now gathering about the link between cannabis use, and in particular skunk, and mental health problems. In this consultation, I spoke to Daniel quite a bit about some of the other side effects that maybe he'd been experiencing, things like seeing or hearing things that aren't there. But also other mental health problems like low mood and depression often coexist with cannabis use. But often the first point of call is to try and address the drug habit before you then go on to try and deal with the mental health problems. So, you've done the right thing by coming here today, okay? I think that's a positive step.
Yeah.
So, first instance, I think we need to get you some help with one of the drug workers who works in the drug clinic in Slough.
I would really appreciate that.
So if you feel that some of the side effects, so your anger, or you feel that you're feeling like harming yourself or anything like that, you must come back and see us, okay? Yeah. Because sometimes we also need to refer people sometimes to psychiatrists who deal with mental health and drug abuse, okay? But I think the place to start is to try and get you to reduce your amount of smoking and eventually stop it, okay? All right.
See you.
All right, take care. All right, bye-bye.
Bye-bye.
Mr. Chiappetta, come in. Thanks for waiting.
Thank you very much to see me.
That's okay. Take a seat over here, please. That's it. My name's Sheila.
Hi, Sheila.
Hi there. How can I help you?
I just cut my finger on the
What are you doing?
I was cut, trim a door with a saw my hands today.
Okay, was it a circular saw? Okay, I'll take that off and we'll have a look.
That one is not bad, but this one, it look quite deep.
Okay.
I put out for all the time.
Yeah, I can see. Are you diabetic?
Yes, I am.
Okay. Oh, you're good at DIY, are you?
Yeah, cut my finger. You can see how good I am.
That's it. Right, let's have a look here. So what state are the doors in at home now?
Oh, it's all right. I didn't kick at the door.
Okay.
And I didn't destroy the saw either.
You didn't destroy the saw. Those circular saws
They're dangerous.
can be lethal, can't
Yeah.
they? Oh, this is really wrapped round, isn't it?
I could stop bleeding, so I
Where's the end of it?
think it's on the bottom.
I've got it here, yeah. Oh, my goodness.
You make a good mess.
I think that might need stitching, you know. Hold that on there for me, please. It's quite deep. You being diabetic, you've got to be really, really careful, as you know, with your,
Yeah.
you know, your extremities, your fingers.
Yeah.
Can you feel this?
Yeah.
Can you feel this?
Yeah, it's a bit dull, but I still feel
A bit dull, yeah.
Yeah.
So we just need to make sure that there's been no damage inside the finger.
Oh, yeah.
Okay, I'm going to put a dry dressing on here for you. This one, I'll dress it, but you do need to go up to the A&E, and probably you might even need an X-ray on it because that's gone in quite deep. Okay. Okay. Right. If you hold that there, and I'll just get some bits and pieces. Will you take yourself up there now or not?
Yeah, well, I have to go pick my wife up anyway.
Yes.
She works in the hospital.
What does she do there?
She works in catering, in the kitchen.
Oh, yeah, yeah. That's it. Oh, my goodness me. It'll get you out the washing up anyway. OK, let's just... I'll just quickly write you a letter.
All right,
and then
I'll
bring it
go
up
straight
here.
up there, yeah.
Yeah, and then go up to A&E, OK? OK, then, I'll just be a few minutes. All right? No worries.
Thank you, sir.
You take care.
All right. Bye-bye. Bye. Thank you very much, Dr. Joangie, as usual.
Thank you very much for your help. You're welcome. Nice to see you. Bye. Bye-bye. Thank you for coming in.
Good morning, Corporate Health Centre. How can I help?
It's getting worse and longer.
Oh dear.
My leg's been that bad and I've been that painful over like days where I can't even get up out of bed where I'm hurting that much.
How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good.
The new tablet can cause urine infections and it can cause thrush.
Oh, lovely.
That's quite painful there.
Well, you poor thing. Well, it's obviously you're going to need to go to the fracture clinic.
Right, OK.
Morning. Thank you for waiting. My grandson's just had a coughing fit where he couldn't breathe and all his chest is hurting. OK. What's his date of birth? Date of birth, Mark?
What, 2000?
22nd
Hello.
of May, 03.
Yeah.
You're supposed to know your own flipping birthday, you twit. Have a seat. Thank you.
Oh, dear. Right, that's a big sigh.
Oh, yes. I was here last Tuesday.
Right.
That's with a UTI.
Yeah.
So I've had it before, but this time was different. It was so painful.
Right.
So I came to the doctor, and then she prescribed for me some antibiotics.
Yeah.
And then she said between 2 to 3 days it should begin to clear.
Yeah.
So today was the last time I took it.
Yeah.
But I still feel pains.
So the urine sample that actually went to the lab, it didn't grow an infection. OK.
OK.
So...
so what's it then?
So Dr. Bolam did dip it and it did show white cells. So any discharge or anything down below?
No, not that I know.
No. Any new sexual partners at all?
No, it's only my husband.
Right, OK, OK. Could you do another urine sample for me now?
Yes, I can do that.
Saying that. Oh, one last bottle. If you go and do that and then come straight back in.
Right, I'll do that. OK, thank you.
Come on in. Thank you. So this is Max.
It is.
Well, we're here today because he's got a sore in the corner of his eye. So it's got to the point now where he's sort of not even sleeping properly because it's bothering that much. Like the other night we were up for 6 or 7 hours with him where he was just... I presume where he was in pain with it, but we have rinsed it out with some salt water. It was a little bit... so
we're talking
not
about...
pussy. Yeah, there's a little, like, in the corner of his eye. There was a little bit of gunk, but I'm afraid that he's rubbing it into his eyes. He's going to get an infection in there.
Hello. This is funny, isn't it?
What's going on? It's sort of catch-22 because he's not sleeping, so he's rubbing his eyes because he's tired, which is then making it worse, sort of thing, you know?
You know what? What I'm going to suggest is if I give you some drops, say keep the prescription, watch it over the next 48 hours, and I'm sure it will be getting better. Yeah. But if it isn't, that's the next thing to try.
Yeah, OK. I know, mate, I know. I just obviously worry because his eyes is precious to him.
Yeah. I don't think there's anything really serious going on. I think that's the first and foremost thing. So keep doing what you're doing. Next 48 hours, I'd expect you should be, if not home and dry, very close to it. If you're not, then you can get that from any chemist.
OK. Thanks for your time.
Sweetheart?
I can't find my patient.
Oh, unless he's gone in the toilet. Oh, I don't know.
Oh, I've lost him.
He's in a blue top, I remember, yeah.
Oh, right, he's not upstairs in the upstairs waiting room, is he? Because somebody's just come to collect him. Thank you. Bye. There's a gentleman there.
Hello.
We've lost all the doctors.
Okay, brilliant, thank you.
I couldn't pee much because
that's
quite kill
plenty,
me.
that's fine.
The sample that the doctor took, she asked me to call the lab to find out whether it's in other results in.
Yeah, well, that's what I said, that it's negative. When she dipped it, there were white cells in there and blood. Right, so there's 1+ of blood and 1+ of leukocytes again. So we'll send it off again. OK, if you jump on the bed, can I have a little feel of your tummy? Just pull this round. OK, so where's the pain?
Here.
Yeah. A little bit there. That's quite sore there, isn't it? Yeah. OK, you can pop your stuff on.
OK.
Most of the time, when we treat a urine infection, when we send it off to the lab, we would expect to grow bacteria. People can have infections in their urine or in their kidneys without it showing. OK. So I feel it's probably worth us treating you with some further antibiotics as you're still symptomatic. OK.
That's fine, thank you.
There we go. I hope things improve. Drink loads as well. Yeah.
Thank you.
OK, but if it doesn't get better, do come back.
Thanks.
OK, no problem. All the best. Bye-bye.
Thank you. Bye. Bye.
Kerry Rich. Hello, hi there.
Hi.
Come on in. You look in the wars.
I have been.
Poor thing. So come in and have a seat.
Thank you.
Yeah, so I'm Dr. Lee now.
Hi. So I came off my bike last week.
Oh,
as you can probably tell.
Yeah.
So I was taken to Southmead. They did lots of X-rays and everything. Nothing's broken, which is good. But my shoulder has given me quite a lot of pain. They said there's nothing wrong with it. There's no break. But as you can see, the bone is in a funny place. And it's just really painful.
Can we just put your hair back?
Can't reach very far with both hands. My chest is really painful.
Is this a push bike you were on?
Yeah.
Wow.
It's really tender.
Can you move that up?
I can move it holding it, but I can't move it on its own. So that's quite painful there.
Can you come across your chest?
With help, I can.
Again, yeah, but
Yeah,
okay.
not on my own.
And I'm not even going to attempt to put your arm behind you.
No, I can't put it. I can't sort of put a cardigan on or.
But it looks to me as if the shoulder is dropped right down. So I'm sure. Did it look like that when you came out?
Well, I was laying down.
I suppose you were a bit out of it.
And I was laying down the whole time I was there. So I'm wondering if they actually realised it was looking like that. Obviously, I know it shouldn't look like that.
No, it certainly shouldn't.
I'll be really breathless.
Really bad breathing.
I might just take your peak flow today and just see.
Take a deep breath in. See your lips rounding.
Blow out as hard and as fast as you can.
As if you're blowing out candles.
Stand up for me and give me a good blow in there.
That was awful.
Gee, that's not bad.
Give it a really short, sharp blow.
As hard as you can.
Great. Hello.
Hello.
I'm Dr. Bolam.
Good to see you.
Right.
A week back, I was here.
Yeah.
I was suffering with every year almost a fever.
Okay.
Apart from that, I'm having asthma.
Yeah.
So it's getting worse and
Oh dear. Okay. All right. So you think this is really your asthma, or a combination of the
combination,
asthma?
yeah, because
All right.
it triggers with. I mean, asthma. It's in control.
It's not in control at the moment, is it really?
Almost every summer.
You always get a bit of a dip.
Starts with hay fever.
Okay, and then your
ends
asthma.
up. Last year I was been to the emergency. Then my GP. He said like we'll try with antihistamine, which I'm trying over the counter.
Yes. Okay, so. Okay, so what you're wondering, I mean, I'll have a little look at you in a minute, but what you're wondering is whether you need the steroids.
Absolutely. That will be immediate relief and controls life.
Okay, well, I will anticipate we'll do that, but let's just check your nose. Okay.
Okay.
Can I just pop this on a finger? And you're not coughing up any spit? You don't think you've got an infection or anything?
Spit in the sense, white stuff sometimes coming. But
Yeah, but nothing green or not mucky looking? No. All right, OK. And what job do you do?
I'm an IT programmer.
OK, right. Can I have a little listen to your chest? Is that all right?
Absolutely.
Thank you. OK. OK. I'll wait till that's finished. You're a bit wheezy, aren't you?
Yes, absolutely.
Do you have a peak flow meter at home?
Yeah.
Might be better to stand up. Let's just have a look what your normal peak flow is. Do you know what it is normally?
I'm sorry, I don't remember.
I feel like coughing now.
It's not contaminated. I don't think it's contaminated.
I don't think you contaminate. I think it's psychological. So the last time you did it was 420. OK. I'll have a quick glass of water. Just blow it over that direction for me.
Oh, I just hold it.
That's better, I guess. No, 260. All right, so that's a bit lower than you were last week when you saw the nurse, all right?
Yeah.
OK. OK. I'll give you some... so the best you did there was 270. All right. If I was you, I think I'd be carrying water around with me. I think water would help a bit, wouldn't it?
Yeah.
Maybe we need to step up your treatment. There are options, but you think it's well controlled most of the year, and it's just bad in the hay fever season, really?
Yes, only summer.
OK. All right. Fine. I don't want to step it up permanently if it's normally all right.
Yeah.
OK?
Thank you very much.
All right.
Cheers.
That's a pleasure. OK. All right. Take care now. Thank you.
Thank you.
Bye-bye.
Where you come up to the waiting room, there's a door in front of you, and the health education is right in front there. But when I phoned her 10 minutes ago, it wasn't open. It may be... Oh, she's there now. She's going to come and collect you. There you go. OK. Take care. Ignore me, I'm not here. What she said, they're all a bit mad here. She's probably right with that. Tell you what, it gets you through the day a little bit quicker.
Neck sprain.
They didn't say that to me.
Oh. I think they completely missed it, actually. I mean, I presume that because the clavicle isn't fractured, because the collarbone is not fractured.
Yeah.
They obviously. Are you all right to go down?
Yeah, I just. Oh. So I'm wondering, because I was like this the whole few hours I was there, if they actually.
Yeah. Okay. Well, you poor thing. So I think obviously you're going to need to go to the fracture clinic. Are you all right? Can you help?
I just need a bit of help. Thanks. Thank you.
What about your face? How's that?
It's fine, yeah.
Is it?
I know it doesn't look it, but it is.
Bikes are so fabulous and so dangerous when you come off, aren't they?
I know. I went back to see where we came off today. We measured it and we reckon I travelled about 100 feet from where I left the bike to where I landed.
How did you come off?
The chap in front of me came off in a pothole and I was right behind him. Yeah.
Really difficult. Let me
so we'll have to wait a long time for this?
No, they run them every day, actually, so I'm hoping we can get you up tomorrow. Let's see. Yes, hello, it's Dr. Liz Lee here. I'm a GP at Hawford. I've got a patient who needs to come to the fracture clinic tomorrow, please. That's marvellous. Thanks very much indeed. Great, bye.
Brilliant, thank you.
Well, that's good. So what did they put on your sick note, actually? Shoulder injury or...
I'm not sure.
Well, I'll put shoulder injury, because that's the thing now. And if I give you 14 days, because I think it's going to take a little while, isn't it, this? So that's 2 weeks.
Brilliant, thank you.
Gone, but you better wait and see.
Thank you
Well, you
very
poor
much.
thing.
All right, thanks.
Okay, okay. Bye-bye.
Rocco?
Rocco.
Have a seat. Cool, that one's a bit fresh, isn't it?
Yes.
When was he born?
He's just over 3 weeks old.
3 weeks?
Yeah.
You a big brother now?
Yeah.
Big brother? How are you then?
He's complained of a sore throat. I can't really see in there. I've had a little look. It feels like his glands are up a bit. He's had a temperature for a few days.
Okay.
Keeps going sky high, but because he said his throat's sore, I thought I'd come and get him checked out.
Okay. Can we put your finger in there? Be careful it doesn't bite you, like a crocodile. You had your temperature done with one of these before?
No.
No? Right, it goes beep, beep, beep in your ear. Is that okay? Ready? Oh, you are a bit warm, aren't you? 38.4. So how long has he not been well?
Probably since about Sunday.
And how did it start?
Just the temperature. That's all I've noticed for the past few days. And he's been saying about his throat hurting.
When did his throat start hurting, did he?
A couple of days ago.
Right then, should we have a look in your throat? How good are you at sticking your tongue out really far? How wide can you make your mouth? Oh, that's pretty good. Right, look at me. Head back a little bit. That's it. Go,
Stick it right out. You've got to, darling, so she can have a look at the back.
It'll only take a second. If you do it
really quickly.
Go on.
We need to have a look to see.
Tell you what, we'll try it without this, OK? Stick your tongue out nice and wide again without this. You hold that. I promise we won't use it. If you've got hold of it, we can't do it, can we?
Stick your tongue
Open
out.
wide. Head back. There's a few little white spots there, I can see. Tiny ones. Right. Let me have a feel under here. Does it hurt under there, or is it OK? OK. Right, let's have a quick listen to your chest. Can you lift your T-shirt up for me? You had one of these before? No? Right. Big, deep breath in. That's it. Oh, brilliant. And again. Oh, you're good at that, aren't you? Wonderful. OK, so his chest's lovely and clear.
Good.
I think he's got tonsillitis, so that'll be why his throat's sore, and he's got high fever. So Calpol, but ibuprofen is going to really help take down the inflammation and help with the pain. So give him ibuprofen with his food 3 times a day, plenty of water, and do you know what the best thing is for sore throats? Ice cream. What's your favourite flavour of ice cream?
No. Bubblegum.
Bubblegum? They make bubblegum flavour
Yeah, you had it last night, didn't you?
Maybe you might be able to have a bit more bubblegum ice cream tonight. You think that would help? Yeah. Yeah, so just plenty of fluids, paracetamol, ibuprofen. If you think he's getting a lot worse, give us a ring before the weekend. Ask for a telephone consultation and we'll have a chat and we'll probably do some antibiotics at that point. Sure. All right, what are you doing this afternoon?
You going to your sisters?
Yeah.
Yeah?
Yeah?
Nana's got them, hasn't she?
How old are they?
9 and 7. 1 boy and 2 girls.
No, I've got 2 boys now.
Now 3 boys.
Oh, and Dad.
Yeah.
Yeah.
That's a big, busy house, isn't it?
We've got a crazy house, haven't we? Yeah, a bit crazy.
I read in the toilet and the bath.
Are you reading the bath?
Right.
Right, let's go. Thank you very
right.
much.
Take care.
And you, bye.
Hello.
I stabbed my toe a couple of days ago. It's a really hard, vicious, angry looking, and it's so painful. And I can hardly flip and walk.
You think it's infected, do you?
I think so. It's really, really painful. It's only small, but it's really sore.
So what are we looking at? Another week?
You look a bit brown. Where have you been?
In the garden.
Ah, I'll have to go there.
Donna? Hi there.
Hi there.
Come on in, have a seat. How are you doing?
Bit better. Not much.
Right.
Financial side of things is slowly getting back together. I went to a job centre Monday. They've now decided until my court date comes through, I can now go back on my SA on the condition that I have sick notes to cover me.
So that's the so it's an appeal for the benefits, essentially. That's what the court issue is. Yeah. Okay. So you do need me to do a certificate today for that? Yeah. Okay. So we're going to put drug addiction therapy on, because that's what I wrote last time. Yeah?
That and chronic pain.
Yeah. Okay. Donna has had problems with chronic pain since her mid-teens and was initially prescribed opiates by doctors, and then she acquired more illegally. The script that she has from me is for a drug addiction therapy, but it is also treating her chronic pain. She could come off her opiate medication, and this might help some of her symptoms, like agitation, fidgetiness, but she has been reluctant to do this. So I'll print that off. And then your scripts, they are going to run out, aren't they? Yeah. So at the moment, you're on 16.8 milligrams altogether. Yeah? Mm-hmm. And what's your thoughts about that?
As it is.
Yeah? Mm-hmm. And are you using on top at all?
No.
Not needed?
Just, but I'm not doing it now.
Right.
Oh, I'm not doing it, I don't know.
Right.
I've had some really bad nights with my legs. It's not so much my knees, it's my legs.
Yeah.
I've got to the point now where I'm sat there in the night time and I'm crying where I can't sleep because I'm tired and I feel like I just want to cut my legs off or just do something with my legs.
I need a kind of certificate to say that I'm proper ill.
You self-certificate for 1 week anyway, so the doctor won't give you a sick note for the first 7 days.
Are you full-time?
Do you think that a sick note for the next few days will be enough?
I could do you a sick note if that would be helpful.
I don't want to get in trouble. They asked me for another one. I know, it's crazy.
10 weeks I can't work.
10 weeks?
Yeah, because of this.
So you went to the pain clinic and they really helped you with your pain management, didn't they?
Mm.
And you went and had lots of advice.
Like I said, I went on a thingy course, pain management course, to help obviously pace, manage. It's hard when you've got kids in that around you.
Yeah.
I do it every now and again. My legs have been that bad and I've been that painful over days where I can't even get up out of bed where I'm hurting that much.
Mm.
I've just completely packed gymming altogether.
Yeah.
I am trying to get myself back up there.
Yeah. That would be good, wouldn't it? My feeling is that you're on quite a lot of medication. It would be best not...
I don't really want to go on anymore. I really don't want to add to that.
I agree. And also, I'm not sure it really helps. The kinds of things that help are you taking a bit more control of things, isn't it?
Which is what I'm trying to do.
And is your partner still being released in the autumn?
October, a bit of luck. October.
Right.
17 weeks and counting.
Oh, really? OK.
I kind of really need him at home to help me.
Yeah.
I'll say some days is a struggle, some days I just haven't got it in me at all. It's like I'm constantly, when I'm sitting, I cannot keep my legs still because they're constantly irritating me. My ankles are still swollen.
Yeah.
They haven't gone down at all. Ibuprofen hasn't took them down at all. I'm still taking them, but...
I think it's likely to be a combination of the fact that you don't do as much as you did, walking-wise, and the reason why we don't all have swollen ankles is because we use the calf muscle to pump the fluid back up to our hearts, and when you do less, then it does make a difference, OK? It just kind of pools down the bottom, and it's particularly bad in the summer, usually.
Yeah.
So maybe before you go out, you need to sit down and do those stretches first, just to kind of relieve a bit of pressure on everything, yeah? Why don't you try that out and see if that helps? OK. Was there anything else today?
No, I've been sick note, that's it. That was my main problem.
Yeah.
Slowly getting there, slowly.
Good. OK. All right, Donna?
Yeah.
So I'll see you in early August or sooner if you need to.
OK.
Yeah?
Yeah, that's fine.
Good. OK. Bye now.
Thanks. Hello there.
Hi.
Have a seat.
Thank you.
Right, what can I do for you?
It's a couple of things. Mainly, I've got an infection in my nose. Probably about a month ago, I had a bit of a cold, quite a heavy cold, and then afterwards got a spot in my nose, and then it's gone a bit horrible, and it's quite... I kind of thought, oh, it'll clear itself up. I'm trying to leave it alone, but it's just not. It's quite hard to breathe.
OK, so it's the spot that's bothering you more?
Well, I think it's got infected. That's what it feels like. It did get much worse.
Yeah.
So to the point that this, like, my nose actually got quite red.
Yeah.
On the outside, like it was quite hard and unpleasant. But it's been weeks and weeks and weeks now, and it still doesn't feel right. I can smell it. It smells wrong.
Can you? Right.
Yeah.
OK, can I have a little look?
Wrong. Yeah.
No chance anything could have gone up the nose?
Well, I don't know, in my sleep maybe. But not anything like that, no. Yeah. I mean, you know, it's just suddenly when you said that, I was like, I went camping.
Oh, horrible thought. Oh, dear. And it's the right side?
Yeah. So I think, so the spot was just like at the front.
Yeah.
Sort of, you know, sort of in there.
Yeah.
But it sort of seems to be all around this sort of area.
Can I just feel around, first of all? Any problems there?
No.
Yeah, so the spot is quite at the front.
Yeah.
I think we should just try some Bactroban antiseptic nasal ointment.
Yeah.
I don't think it warrants antibiotics.
Yeah, that's
okay.
fine. Yeah.
Because it sounds a bit blocked, and could it be a bit of sinusitis as well?
Yeah.
But generally that resolves on its own, and
Brilliant.
oral antibiotics don't make it any quicker.
No, that's fine.
Is that okay?
Yeah, no, I'm absolutely fine with that. I'm also sorry. I'm just going to get it all out at once because I think I'm probably just need a rest. But I think I've got labyrinthitis again.
Right. How's that affecting you?
It just makes me feel low-level dizzy slightly all the time.
Yeah.
Labyrinthitis is an infection in the inner ear, and this can affect your balance and hearing and occasionally cause nausea and vomiting as well. It's most usually viral, so often after a cold or flu-like symptoms, but often it eases off over a week or two.
There isn't anything, is there, apart from probably just resting and getting better?
When's that going to happen?
Summer holidays. I work in a school.
Right.
I'm the office manager in the school, so it's...
How long's left?
4 weeks.
OK. So are you looking after yourself at the moment, sort of in the evenings and weekends and rest?
Trying to. slightly unsuccessfully.
Delegating?
Trying to. There's just a lot. It's that last term of the year, so it's quite full on. So.
What about at home?
Well, I've got 2 children, 9 and 10. There's quite a lot on for them too. But yeah, so I'm not doing that very well, and I do recognise I'm not doing that very well.
Yeah, it's hard nowadays, isn't it?
It really is.
I read something at the weekend, actually, putting a thing, a block on your email. I am not reading emails after 5 o'clock on Friday or whatever.
Well, I'm certainly intending to do that from September.
So why can't you do that earlier?
Because there's too much.
Because what will happen in September? Oh, it's the start of the term.
Yeah.
It's.
No, you're right.
So doing more than you meant to, I think, is the norm these days.
Yeah.
But doing it that you're feeling a bit run down, I think that's where you need to have a think. Yeah. Is there a way you could have 2 days off for the weekend?
Yeah. And have the weekend.
Yeah, because it's so hard.
To get the balance, yeah. No, you're quite right.
Yeah.
I mean, it's how it should be, but yeah, no.
Yeah, there we go. OK, well, I hope you cope till the end of term. Yeah. Be nice to yourself.
Thank you very much.
If that doesn't clear up, please do come back.
Lovely.
All right.
Thank you ever so much.
No problem. Bye-bye.
Bye.
Oh, blimey.
That's okay. Right then, so you come for your ischemic heart review today, yeah?
Yes, that's right.
Okay. So how has everything been? Any heart pains
No problems.
or anything? So we just check your blood pressure. Okay. Oh yeah.
Yeah, that was the last sentence. Took my blood.
Oh, shame.
I think she was next. No, it was just from those days.
Yeah, it is, isn't it? I've had bloods taken before and bruised all up.
Yeah, just getting the vein right.
Do it again in 1 minute, all right?
Yes, OK.
So just, and how active are you?
Oh, moderately.
Yeah.
I did go dancing on Saturday,
Excellent.
which is quite an achievement.
Definitely. What music was it?
Oh, mostly sequence and modern ballroom dancing.
Oh, how lovely. Right then, gonna do it one more time. I think it's
That's my
lovely.
granddaughter, she's only 12, and she's very good. She's good at most of the adults there.
Oh, good. Can I check your weight? Is that okay?
Yeah.
$86.
What
I'll convert for you.
Yes, well, that's converted to...
Yeah. Oh, you've lost weight, actually,
Yeah,
since
well,
last year.
I tried to keep it balanced.
Definitely, yeah. 13.5 stone.
Not bad.
Good. Now, the blood results then, let's have a look. The only thing that came up was that the blood that we do that kind of looks at the amount of sugar is slightly up.
Is it?
I mean, what do you eat?
Average stuff, you know.
Yeah.
I don't take sugar with tea or anything like that, but I do eat cake and biscuits and things like that.
Yeah, it might be just worth cutting
watching,
that back.
watching it,
yeah, you know, just things that are more like sugar laden.
This is the first time I've ever been told this, actually.
So that's the only little hiccup is the sugar. So we'll just keep an eye on you. Yeah. But otherwise, carry on. Thank you ever so much.
Thank you very much indeed. There we go.
So I'll see you. I'll put it in the notes that you're to have the blood test repeated, so they know what they're doing when you come in.
Okay. Yeah,
all right.
thank
Lovely
you.
to meet you.
Thank you.
Take care.
My son, I'm not sure if his hearing's right or if he's just being ignorant.
OK,
So-
that's fine. What's his date of birth?
Coco.
Yeah, go on then.
You're going to come this way with me.
Come on then. Hello, doctor. Here's that.
There we go. Who have you brought to see me today?
Coco.
Coco.
I think she's got hay fever.
Right.
She's waking up. When we're outside, her nose gets really snuffy, and her eyes cry, but she's not crying.
Okay.
They just run tears.
How did I freak up?
Can I get the... Be quiet.
She's under 1, isn't she?
Yeah, I took her to the chemist and they said she was too young for anything.
Yeah, it's quite unusual to see it in children so young. And when did you first notice it?
We were out. We went to a little festival,
Right.
and that's when I really noticed it. As soon as we got there.
Okay.
She was just miserable, and she was fine at home. But it's when we got there, and then her eyes just started watering.
And it was grass and.
It was hay, actually.
Hay,
There was
okay.
boughs of hay. It was it was a street.
Fine. Okay.
So we thought maybe she had hay fever.
And then since then?
Since then, it's happened again once, and we were out in a field.
Fine. So it's sort of it's specific to those
Areas.
settings.
Yeah,
Right.
yeah.
So it's pretty clear, as you say, that it must be something to do with it. Is there any hay fever in your family?
On my sister's, yeah. Blue Jay's got bad eczema, and I suppose is that all linked?
Yes.
Yeah.
Yes, it can be.
She's got really bad eczema.
Yeah. Okay. But Coco's skin's okay.
Her skin's fine. Yeah.
Okay. They've kind of made it rightly more difficult to prescribe things for little ones, because I think there was concern that kids were being given stuff that wasn't suitable for them.
You've got bad skin, haven't you?
Check.
Eczema, you've got.
This is hurting me again.
Let me see. Where are they hurting you to? You can't take them off yet because you need to walk on the floor.
Okay, let's have a look. Oh, actually, it does say we can use 1 milligram twice daily. And you'd only need to give it her in the circumstances.
If we were to go into like a grassy area.
Looking very serious, young lady.
Yeah.
There we go.
Thank you.
Okay. Bye. What about your shoes?
You need to put your shoes on before we go outside, okay? Yeah, we're going to go outside now in the street. Come on.
I want you to carry me.
I can't carry you. I've got to carry your sister. Thank you.
Let me do the door, hang on. You don't want shoes, then you want Mummy to carry you?
Say bye, say thank you.
Bye.
Peter Fraley. Hi. Morning.
Sorry?
I said morning.
I heard you the first time.
Sorry. Just trying to be friendly, you know. It's just
Yeah,
my
I know,
standard
yeah,
politeness
as you
thing.
are.
What are we talking about today? How are you getting on?
Heaven knows. You told me to come back in a fortnight.
Yeah. How have things been?
Well, 4 or 5 days I felt quite bright. And then back again.
Yeah. And there was also the question about starting this new tablet from the diabetes.
I don't know anything about a new tablet.
So the new tablet is designed to try and improve the sugar control. And its side effects are that it may cause you to get some urine frequency, and it can cause urine infections, and it can cause thrush.
Oh, lovely.
And what the guidance is you drink plenty, like loads.
Yeah, I've been drinking lots.
Saying drink a glass of water every hour in order to make sure that you're well hydrated all the time.
Yeah.
But if you're OK with that, we could get this new medicine started.
Yeah.
And hopefully that will bring the sugar levels down. When did we last check the sugar level? Just give me a... April.
Was it? Oh. For months now, I get into bed at night and I get only the top half of me, a tingling sensation in my arms and my chest.
OK, what can I do for you?
I've been getting terrible night sweats. Awful.
At night, I have to wake up because I cough really badly.
It keeps me awake at night. The pain.
I couldn't sleep at night as well because I can't put the coil on.
The quilt hurts.
The quilt hurts.
Right. So just at night, you're coughing lots.
I've had a chronic earache for the last week. OK. But it's getting really bad now. It's like really chronic pain at night. It's keeping me awake. OK.
You're tired.
Where are you going to stick?
Tired, aren't you?
I just want a better night's sleep.
I get a tingling sensation in my arms and my chest, and then it just goes away.
How long does it last for?
A couple of minutes, if that.
And every day, every hour, every minute?
No, only at night.
Only at night. And does it kind of shiver over you, or is it?
That's the one.
Yeah.
Yeah.
Okay. And is it all normal when I touch you? It feels normal?
Yeah, fine.
Okay. Just put your arms out in front of you, palms towards the ceiling, close your eyes. Squeeze tight, pull me towards you, push me away. That's lovely. So that's all working normally.
Yeah, it's just an annoyance.
Yeah. How bad is it? When you say it's an annoyance, is it stopping you doing anything? Or
No. Ow. It's just like you go, like that.
Yeah.
I just thought I'd mention I've had it for months and months and months.
I mean, sometimes when you have diabetes, it can affect the way that the nerves work. And this may be that you're getting symptoms linked to the nerves being affected by the sugar, because the sugar coats the nerves and stops them working properly when you get diabetes. And this may be one of those symptoms of
Well, that's
diabetes.
what I put it down to. It's got any worse, it just comes on now and again.
Yeah.
And then
there isn't an obvious, easy fix for it other than keeping the sugar level really controlled. And it would be worth us checking the other vitamins that sometimes cause nerve symptoms to make sure that they're OK when you have your next blood test as well. So
is there anything I can take to make me feel brighter?
Well, there's not a magic potion, if that's what you mean.
I know that.
Like a tonic or something like that. But getting the sugar level controlled is the
thing
best
as a
thing.
tonic.
I know.
You told me that before.
Probably did. Well, the main thing is getting the sugar level down.
That saccharin's OK to take with...
Yeah, so that's better than taking sugar, yeah.
I hate sugar, but when I have my Weetabix or whatever, I have a sprinkling of that, and that's OK.
Exactly.
So I don't want to take... I had a big Spassenberg last night, and I was a naughty boy. I know.
Oh, well.
Well...
These are the challenges of life, aren't they, though? And it's very difficult to avoid everything. I do appreciate that.
I'm quite bright this morning.
Good. Well, let's see how we get on with this new tablet. I'll see you in a few weeks' time when we can see how it's getting on.
Yeah.
Maybe a month's time.
Yeah.
All right.
Thank you very much.
See ya. Bye.
Ooh.
He's still here?
Well, the hours, yeah.
Oh, really?
Yeah.
One of those, yeah.
Puspa Patel, please. A bit of a hike down the corridor, I'm afraid. That was a bit of a mini marathon. OK. So, how are you? She's all right?
Yeah, the tablet's done the job.
Done the job?
Yeah.
Really?
Yeah.
The problem she had before was the food coming back up. That stopped happening?
That stopped happening now. Yeah.
That is a good result, isn't it?
Yeah.
So we checked the poo sample and that was clear. She didn't have that bug again.
No.
So I think that the problem, therefore, is this, you can translate for me, obviously, the hiatus hernia, which they found when they did the endoscopy. If she doesn't take those tablets, that causes acid to come up and cause that problem. OK?
Yeah.
So I think she should stay on these tablets for life now.
Okay. So tablet આપી છે ને એ કાયમ માટે આખી લાઈફ તારે લે જ કરવાની હવે નહીં તો પ્રોબ્લેમ થયા કરશે પાછું એસિડ. Okay.
Does she feel in agreement with that? Is she happy with that?
She's happy with that.
She doesn't want those horrible symptoms back again, does she?
No.
OK. And then she's on her calcium tablets for her bones.
That's right.
And her asthma treatment and her water pills. Well, I think that was a good decision that we made last month, wasn't it?
Yeah.
We didn't need to do an endoscopy.
That's good.
OK. And I think, you know, hopefully, obviously, you come back and see me if there's any problem.
Yeah.
Is that all right?
That's all right.
OK.
What about him?
Does she want to ask me anything?
Puchus ka si?
I had a good days.
She said if I'm not well, I'll come back.
Of course. OK. And no trips to India planned?
No, not anymore.
Not anymore?
Finished.
No, finished, yeah. OK, all right.
Oh, she said in 2 days' time she'll be 86.
Happy birthday. All right.
Yeah, thanks very much.
Thank you very much.
Thank you, bye.
You all right with that long walk again?
Yeah, thank you.
OK, all
Thanks.
right then.
Bye.
Bye-bye. So you know where I am.
morning, the Ridge Medical Practice. Vicky speaking.
Try not to bite my finger off, OK? I need it for work.
And do you know why I would like you to stop smoking?
Because of my chest, I know.
Do you feel like harming yourself?
Not right now, but you never know, do you?
It's funny how you've been well all through your school holidays, and then the day you go back to school, you get poorly.
Your sugar now. Pre-diabetic. Yes, you're getting a gold star. Woohoo!
Morning, Emily.
Morning.
Come in.
Oh, hello. Hi. Are you ready for us? I am, yes. I just dazed off and gone on to something else.
It's quite all right.
Come in. Hello. This is Betty. Hi. And I'm Jane. I'm looking at a daughter-in-law. Oh, right, OK. So they seem to say you had a few bits and pieces that they wanted us to check.
Well, it started with that about 5 years ago.
Oh.
Then that. And I've had put Germaline on every day, but it hasn't moved it.
Right.
And then I've got all sorts.
You have, haven't you?
Yeah. And I've got one behind there and that itches. Can you see it?
Yes.
And then I've a few. One on my shoulder there.
And then on your face, this
one. These are mostly, I won't get rid of these. I'm not bothered about
You nearly forgot about them, didn't you?
And these, I mean, these are driving me mad. There's one behind me here. And that cheek there. And the touch on my forehead there.
Oh, goodness me.
But I want really want these on my face. I mean, my beautiful face, you see.
So can I have a look at them? Sorry, this is a bit of gel.
Oh, of course you can.
Yeah, and a bit of a light.
Just want rid of them on my face.
I've been feeling...
Poorly?
Yeah.
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
Yeah, as well.
What kept you awake?
In my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be, Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You go and sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good.
Good for Dad.
Good.
It's funny how you've been well all through your school holidays and then the day you go back to school you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning and you're a raisin? Can't go to school then, can you?
Don't we?
Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right.
Take care. See you later.
No worries.
Sorry, what made you sort of come now? Have you suddenly got a load more?
I've been telling the doctor about this for years.
Yeah.
And he said you'd better go see a dermatologist.
Yeah. What about these on your face? How have they sort of progressed over the past 6 to 12 months?
Sometimes bits drop off.
Yes. That's not anything to worry about. But still, we want to try and treat them, and I'm just trying to think how's the best way to do it. So you've got a lot of different bits and pieces.
Yep.
I think that they are mostly sunlight damage. I was wanting to get the advice of our consultant, and she's here next week. I know it's a bit inconvenient to come back, but I'd just like another brain to help me suggest what to do, whether there's some that she thinks she's a bit more worried about and perhaps we should take a little sample and whether there's others that she'd just be happy to put some creams on that will irritate. So they'll go quite nasty and crusty, and then it starts to come back beautiful again, but without surgery.
It'd be nice if it were ointment from my face.
I know.
Yeah.
Well, it wouldn't be nice while it was working because it'd get really crusty and it'll look a right mess. No, but it doesn't matter because after a couple of months it'll look beautiful again.
Oh,
so
yeah.
that's what you want, isn't it? It's a full facelift. Okie doke.
Thank you very much.
You're welcome.
Lovely.
Okay. Thanks for your help. Thanks. Take care then. So I'll see you next week.
Yes.
Turn right. Turn right.
Bye.
This way.
Oh, I'm going the wrong way.
I've got a really, really, really big spider. Oh, wow, it is a big one. Look at it.
Oh my God. It's a monster, Shelley.
It is. Now I need something to shimmy underneath. Come on, mate. Ooh, look how big he is. Whoa, oh my God.
Absolutely huge.
I'm gonna just go. Let's go for it. There you go. Ugh.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know.
Okay,
I mean, that's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because
Yeah.
when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing.
Yeah.
Then it gets really itchy. I mean, as you can see, the skin gets really dry.
Yeah.
Right, and it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had... anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that?
Do I need to book it?
Yeah. But just use the words health check, NHS health check.
Right.
And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just...
I mean, to be honest with you...
general MOT, but...
Yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
Yeah.
No.
You do the exercises, don't you? Yeah.
Exercises are the way forward.
Are you doing any stretches? Weird movements, yeah, okay.
Can you just pop your arms out again for me?
And your legs rotated a bit, and she cried.
Oh, dear me.
I'm tired, Jenna.
What have you been doing?
Nothing.
Nothing.
Sometimes doing nothing makes you more tired.
It does. Come in. Hello, come in. Mr. Hussein.
It is.
Come and have a seat.
Thank you.
I have a student with me as well today, if that's
problem.
okay.
That's no problem. I seem to be getting a lot of pain. It's been like just over about a week and a half.
Mm.
It's like all back of here, all my arm, and it seems to be, like within the muscles. I mean, as soon as I press, I can feel the pain.
Okay, and anything trigger it that you can think of? You've not moved house or lifted heavy stuff or...
If I did do it, I mean, I'm more right-handed. I would have done something with my right hand, not my left.
Okay, let's have a look then, shall we? So, if you just stay sitting for a minute. Is it tender up here?
Yeah.
Whereabouts? Is it?
Well, it's more
at the back?
Yeah.
I could do to have a look at this shoulder. Do you think you could take that arm out your T-shirt? I'm conscious of you.
And can you tell you the truth? When I'm sat down not doing the thing, you can feel the throbbing more, you see. That's, really tender,
So can you lift your arms up in front of you?
Yeah, I mean, I can lift them up. I can feel the pain hurt more when I try to lift it up more high.
Can you lift right up to the top? And that's hurting here in this muscle?
It's hurting all the way along here.
Okay. Can you lift your arms out to the side?
Yeah, I mean, I've tried all this at home, just to kind of try to ease them off.
So from looking at you, you can put your arm back in your
your T-shirt now. From assessing you there, I don't think this is the shoulder joint. I think you're right. I think it is a muscular pain. Perhaps you need to have a think about what could possibly have caused it, but the main thing I would say is give it some time. Give it a couple of weeks. And if it's still there in sort of 4 to 6 weeks' time, come back and see us. But I would expect it will go.
But what would cause it going all the way right down?
So you've pulled muscles. You've pulled the muscle here in the chest, and you've also pulled some muscles in your arm. How? I'm not entirely sure, but it seems to me like you've strained some muscles, maybe by lifting a bag or... I don't know. It can be quite a fine balancing act, getting it right between not being dismissive and listening and understanding patients' concerns. In primary care, us general practitioners are gatekeepers, and it's okay to watch and wait sometimes and not jump to investigations straight away.
It just kind of hurts a lot, you know.
But I wouldn't worry. I'm confident it'll settle. Okay.
Yeah.
All right then.
Okay, my love.
Okay.
Thank
Thanks
you.
very much.
Okay, my love. Okay, thank you.
Take care.
Okay, my love. Thank you.
Bye-bye.
What about these chest pain?
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when
catches
you're
me
breathing.
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
You know, it's that type of thing, you know what I mean? Okay. And when I'm breathing, you know what I mean? It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or...?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway. Yeah. Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know, I mean, I'm trying to reduce them as much as possible, and hopefully, you know, come off them. But it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Youssef.
My pleasure.
Thank you.
Bye.
See you.
What? Oh. Mrs. Kirby, please. Have we a Mrs. Kirby? Oh, bloody hell. Mrs. Ingham, although you're not on my paper list for today, my computer has all of a sudden woken up rather groggily, and your name is on my computer list. Emily, come and let's both fight with the computer, shall we? Computers are great when they work.
Here we are. Come on in.
Hi, Tatiana. I'm Dr. Carr. Nice to see you. Come and sit down. So I believe I'm seeing you for something on your knee. Yeah, okay. How long have you had that for?
I have a couple years already, but before I even came here, but it was very little and it's now growing more.
Yeah.
And that's why I'm all the time with babies. I'm staying on the knees and it's make pain for me.
Yeah, of course. Do you mind if I have a closer look?
Yeah.
The only bit you'll feel is a little needle going into the bottom of it and putting some medicine underneath it to numb it. After that, you shouldn't feel anything at all. We then make an incision over the top of it and it should just come out, and you'll have 2 stitches which will dissolve themselves over the course of a week. And you might be left with a little scar where it's been, and otherwise...
Maybe better.
Maybe a lot better than what it is now, yeah, definitely.
Yes,
happy to get rid of it? Good. Right.
So if you make yourself comfortable on here...
Do I need shoes off?
You're okay, it's fine. How old's your baby?
Oh, 8 months now.
Oh, how nice. Is it your first one?
No, third one.
Third one, wow. How old are your other 2?
6 and 2.
Oh, you are busy
Very
lady
busy.
then. Yeah. Are you nervous? Don't be nervous. It'll be all right.
So I'm Susan Towers, I'm a GP but with an interest in skin problems. That's why it's Sister Eve, wasn't it, that sent you here?
Yeah.
Linda.
Linda.
Okay. She said that you've been having trouble with your face for a few years.
Yeah, it's been after the birth of these twins.
We're blaming them, are we? Yeah.
No, actually, everything was right. Everything was okay. My face was really good. But it's been last 2 years I am having this problem.
Right.
And I am having it just before my period, every month. Sometimes every month, sometimes every other month. Can you see this spot?
Yeah.
All around my face.
Yeah. Is this a good day, is it?
Yes, it's really, really good.
Well, we can definitely do something for this. This is acne, and in some people it does start later on in life. It usually starts in the teens, but in some people who are unlucky it can start in the 20s, 30s, even 40s, and then it's much more stubborn, unfortunately. So sometimes we need to use quite strong treatments. The problem that you've got is caused by your grease glands being too active. They're making too much grease, and the gland itself is getting blocked. Okay. So when there's too much grease in a gland, sometimes you can see it like a blackhead.
Yeah, blackhead, whiteheads everywhere.
Whiteheads, exactly.
Yeah.
And then sometimes the gland sort of stretches and stretches and gets very inflamed and red, and that's those red lumpy bits that you're describing.
Everyone this pop.
Yeah.
Oh my God, sometimes at night,
Really
sometimes
sore.
in morning.
What I'd like to suggest to you is this strong treatment called Roaccutane, which really shrinks the grease glands and makes them small again. It's the only treatment that does that.
Okay.
One thing that's important is you can't take this if you could be pregnant or planning a pregnancy in the next few months.
No, not at all.
No, not at all.
No.
Because this tablet always damages a baby as it's growing. So that you would be advised to have a termination. So it's really, really serious. Okay, so that's one thing.
Yeah.
It can also affect your mood in some people. It's very important for patients to understand the potential side effects of prescription drugs. It's a bit of a contract between us and the patient. We need to think about whether it's safe for them to take that medication, if there's other things that might interact with it. Most medications are taken safely and without any significant side effects, but if there's some particular medications which we think have a potentially serious risk for an individual, then it's important that we talk about those. Sorry, I just have to ask that personal question again. If you're sexually active, you must use 2 methods of contraception because this medicine so often damages growing babies. But just bear it in mind. And each time you come, we'll need to check a pregnancy test. So don't be upset that we're asking you to do a pregnancy test. It's just what we've got to do. Okie doke. So we'll be seeing you probably in 4 weeks.
Okay, thank you.
You're welcome. Thanks. Take care now. Bye-bye.
I'm just going to test it. Tell me if this feels sharp.
No, I feel that you touch, but not...
Yeah, nothing sharp. That's fine.
No.
You'll feel a bit of pushing and pulling, and that's normal.
Yeah.
You know, Tatiana, I'm opening this up now, and it doesn't look like a cyst. It looks like a bit like if you got something in your knee, like a piece of wood or metal. So
Like something inside.
Yeah. Often people get like a little chip of wood or a little chip of metal under their skin, and then you can form a granulation tissue around it, and it forms this hard surface like this. So I suspect that's what's happened. And it's in one of those positions where you're likely to kneel onto something, and it...
Yeah, when you touch, it's like little ball inside.
Yeah.
You know? It's not...
It's okay, we'll get it all out. It's not a problem.
You okay?
It's nearly done, yeah.
Is it hurting?
No, no.
All right.
It's all right.
Really doesn't want to leave you, Tatiana.
No, it likes being in there.
It's quite at home here. Right, it's gone. We're just going to put the stitches in and then we're done. All that for that. You have a nice smooth knee now. You'll have a bit of a bruise where it's been, but it's all gone. And Karen, I'll just put a little dressing over it, and that's that.
I'll just lower the couch down.
No problem. In a week's time, it'll look beautiful.
Okay, thank you. Thank you.
Hello.
Hi, are you okay?
I'm fine, thank you. Sorry to keep you waiting. How is your dad? How is he feeling?
That medication you give him isn't working at all. So we've had a lot of down days. He don't go out or anything now. He's just enclosing himself in house.
Okay.
So from last time we seen you, it's just got worse.
Okay, he doesn't want to leave the house.
Yeah, he tries to enclose himself.
Okay.
He's fell more into depression and anxiety and feels more worthless.
When you say worthless, is he trying to harm himself?
Yeah, we had to ring first response unit, and they said they're going to send him an appointment out.
About 4 times a day they were ringing.
Yeah, they said they're going to send him an appointment out for mental health team because he needs to be assessed. But I told them we had an appointment with you today, and they said that it'd help if you could refer him to mental health team as well.
So they want me to refer him to the mental health.
Yeah.
Okay. Do you feel like harming yourself?
Not right now, but you never know, do you?
Okay.
Anything could just trigger it. It's what goes on. It's what the voices he's hearing in his head and stuff.
Oh, is he there? Is he there? Oh, he is, and he's got blue eyes.
Brain surgery. Well, there's no brain there.
That's naughty, isn't it? Hey, look at you. Come in. Right, so which one's Hardy?
Hardy's this one.
Yes.
He had been diagnosed with hand, foot and mouth.
Yeah.
So that's...
How is he doing after that now?
He's not been too well, you know. He's, it doesn't seem to be picking up. And, like, his mouth is always sore. And it's still, like, I can see a few spots in there.
So is he eating and drinking?
He's not back to his normal pattern of eating and drinking since the hand, foot and mouth.
Yeah.
But when he does eat, sometimes he'll complain like, ow, that hurt.
Okay. Did he have any ulcers or any skin problems anywhere else when he had this?
He had some spots on his hands.
about
They've
his
all
feet?
cleared up, and on his feet.
And if that's all
There's
better
one
now?
little scar left, but it's all cleared up.
Can you take his top off for me? Hardy, can I just have a listen to your chest, sweetheart? I know it's not nice coming to see the doctor, is it? Good boy. His chest is lovely and clear. I'm just going to check his temperature quickly. I'm just going to pop this in your ear, sweetheart. It shouldn't hurt. That's perfect. Can you open your mouth for me, darling?
Go ahead.
Ah. Ah. Stick your tongue out, like really naughty. Be really naughty and go,
How do you go like this? Good boy.
Ah.
On that side as well, I saw the spot. Don't know if you can see him there.
I'm going to put my finger in your mouth for 2 seconds. Try not to bite my finger off, okay? I need it for work. Can I just have a feel, my darling? Does that hurt?
Where's it hurt, Hardy? Oh.
That's fine. That was good because he opened his mouth. He's got a tiny, tiny ulcer in the back.
Is it just the one?
Just the one that I can see. The throat doesn't look inflamed or anything. I can't see anything that worries me. So it can take a bit of time for these ulcers to get better, especially the ones in the mouth. Have you tried to use anything?
Bonjela.
Yeah, and is that helping?
Not really.
It's the only thing that we can really recommend for kiddies that age. You probably know this already. So I'd advise you to carry on using that Bonjela. But if he's still not right in the next couple of weeks, then just bring him back.
Okay.
They're all very good, your kids, aren't they? Is it an act?
A cover-up.
What do you want me to do for him today? Because I can speak to the first response, okay? If he's feeling suicidal,
I think what we need to do is possibly if you could refer him to mental health team for mental health team to assess him personally rather than on a form.
Okay, I can do that, okay? Are you happy with that? Yes?
Yeah.
Okay. Will you be there for him?
Yeah,
and will
there's
somebody be on
family's
him?
watched all the time, yeah.
I hope you understand the reason
yeah.
I'm asking
Yeah,
this. And we need to see him again after about 4 to 5 weeks because we are increasing the dose for him.
Yeah, that's fine.
Reasonable?
Yeah.
So we'll see him and I will refer him to the mental health team as well. Happy with that?
Yeah. Yeah.
You agree with that?
Yeah.
Yes?
Yeah.
Because he doesn't talk much.
Because he's really low. We can't let him have sharp objects around just in the kitchen to cook just in case because he gets things in his mind and stuff. So
we'll just do what we have planned?
Yeah.
Is that okay?
Yeah, that's fine.
Is that? Yeah? All right. Then.
Okay.
All right.
Thank
then.
you very much.
Thank you.
Thank you. Bye.
I like doing this. Is this a geeky thing that you like to do?
No, I like doing that as well.
It's quite
therapeutic.
Yeah. So there's 4 number of scripts and 4 on each thing, that's 16 in it. What's 12 times 4?
12
times 4?
48.
If you wouldn't have been here, I'd have used calculator on there. I would have been like that.
Bless you.
Hiya, come on in.
Hiya.
Medication review, that right?
Yes.
And how are you feeling in yourself?
Okay.
How many do you smoke then?
I don't know, it varies. When I'm working, I don't smoke, you see.
Right.
Obviously, can't smoke in work, but I do.
What's your
job? I work at warehouse at distribution centre.
Right. Okay.
I used to work somewhere else, then I got sacked, so.
All right.
But that really does the atmosphere in me.
Made your chest worse, did it?
Made my chest worse. Yeah. But this is dry.
Okay. So your blood pressure's up a little bit. You see that you'll always be a smoker?
Probably.
Yeah.
To some degree.
And do you know why we'd like you to stop smoking?
Because of my chest, I know.
Have you tried to stop?
Not really.
No. Can we give you some help to stop? To try to stop? What do you think? And what would get you to that point where you think, I'm going to have to stop now?
I mean, if my chest got that bad.
Yeah.
Like, no.
Yeah. But if we know your chest will end up that bad, if you carry on smoking.
So I should...
and it usually takes
stop.
people, averaging about 7 attempts to stop. So you've just got to keep trying to stop. And the message really is that if you don't stop first time, doesn't mean you'll never stop. Just keep trying to stop. Right, my suggestion is just maybe start you on 1 blood pressure tablet and come back and see me in about 3 to 4 weeks, and then we'll make sure that you're okay on that tablet. But I'd like your blood pressure to be a bit lower. Is that okay?
That's fine.
And do come back and see me.
Yes.
Yeah.
Don't worry, I'll come
Don't
back.
sleep in.
Oh, what sleeping? I never sleep in.
That's all right.
Once my alarm goes off, I'm up.
And have a think about a few of the things we've just been chatting about.
I will do.
And then we'll set up a plan for the future when I'll see you next time.
Right, okay, thank
Cheers. You take care.
Yeah, you too.
See you, Paul.
Okay.
Pauline.
Sorry, I was in the ladies.
Is it working?
Sorry, yeah, yeah. Oh, yeah, I was in the ladies, so I didn't get it. Sorry.
I'm putting it back. Right, I've got
Student again.
Separate here.
Yeah.
A doctor,
Oh,
one of our new
doctor, hello.
doctors who's just learning the ropes.
Oh, bless you.
Right. Pauline.
Yeah. First, there's 2 things. First one, say that still going really well with the tablets. I still feel anxious, still not sleeping well, and I still get moments of just feeling numb. I don't know, I just need advice.
So at first, when you first started the tablet, they helped?
Yes, they did.
They help with
yeah,
the
for the
sleep.
first couple of nights they help.
The fact that you have noticed a positive difference is really good, because usually we say allow it 4 to 6 weeks.
Yeah, so it's been 4 weeks I've been on them now, I think. Still not getting off straight away, but then when I do go off, I have a really good sleep, so that makes a
that
heck
must
of a
make you
difference.
feel
It does,
better.
it's wonderful. The other thing, I've got ulcerative colitis, and I don't know if it's a coincidence, but 2 weeks ago I had a colonoscopy, and since then my tummy just hasn't been right. I've had constant diarrhoea. I spoke to the IBD specialist nurse, and I went to the hospital Monday, took up some stool samples, and they took some blood samples. Still haven't had the results of those back yet.
So before the colonoscopy, they'll have had to give you some bowel prep, won't they, to clear you out? I wonder if it's that then that's sort
Well, it could
of
have been-
aggravated
yeah,
things.
exactly. But it's never... I've had quite a few colonoscopies, obviously, and I've never reacted to it in this way before.
No.
And
That
it's
was
just coming
sensible.
out of me like sludge,
Yeah.
really, you know. It's just not formed at all. The problem is I had to come home from work last Thursday with it because I just couldn't work. I travel on the bus, I don't drive, so of course I
It's
can't...
access to the toilets. It's not pleasant, is it?
No, that's the thing. I mean, I wouldn't dare go for the bus because, you know, it comes on urgently and I have to go. So really I need a sick note, please, for
Yeah.
another week just to hopefully get some results back and get back to something like normal.
Of course we'll give you a
Thank
note.
you.
Yeah.
It's just never gone on this long before, you know. It is what it is, isn't it, unfortunately? There's nothing I can do.
You did the right thing by phoning the nurses, so hopefully they'll pick your message up and they should have the results back by the end of today.
Yeah, hopefully, yeah.
I mean, I know they're busy, aren't they? But
that's lovely. Thank you for your time again today.
All right
Much
then,
appreciated.
no worries.
Thank you.
Take care.
I will, and you. Bye-bye.
Bye-bye.
Bye.
My mum wants to get a dog. I said, who's going to look after that?
So I've just got a dog and he's only 7 months. Labrador, yeah. They're just greedy, aren't they?
How's your little doggy?
He's all right.
Oh, have you got enough of him now?
No, he's been a little bit naughty this week.
Oh.
I smell something right weird. Have I stepped in something?
Oh, my first ever picking up dog poo experience, which was quite a big thing really, the first time. And he did a poo on a bramble, a sloppy poo.
It's not me, is it?
But there was someone behind me, so I couldn't ignore it.
I'm funny.
Coming in. Hiya, Mr. Russell.
Yeah.
Hi, it's Dr. James. Nice to meet you.
Oh, I've sat down enough. I've sat down enough. I can't
Do you
sit
want to
down.
stay standing up?
Yeah, if you don't.
That's fine, yeah, I'm cool with that. How can I help you today?
I've had a crick in my neck,
Yeah.
but I've also got a bad back.
Right.
I don't know what's happened. I took my dog. I went up to hospital a couple of weeks ago because my dog went through my legs and dragged me over. I'd badly sprained my leg.
Mhm.
It was in that much pain I couldn't walk on it. But I didn't mention my back, but my back's just got worse and worse and worse, and it's really sore and I can't sit down.
And how long ago is it now?
About 5-6 weeks.
Oh, right, so it's quite a long time.
It's quite a while ago.
So can you show me which point it's most tender on?
It's mainly this part here.
Okay, I'm just going to gently feel down the middle of your spine first.
Just there.
Okay. Is it there as well?
Yeah, that's it.
Sorry,
That's one.
sorry. And you're able to just lay down on the couch here? Now just let me know if you feel any pain. Right, where's that?
That's just a box.
The bottom there.
Bottom.
About this side? Same place?
Yeah.
I'll let you jump off then, just nice and slowly. Jump off's the wrong word. Just gently step up.
So when I breathe as well, that hurts.
It's all spasmed up, isn't it? And what your body does in response to any pulling injury on your back is it thinks, oh no, that's my back's important, I need to keep it stable and the muscles go really tight. It's almost a bit like a whiplash injury, you know, when you jerk forward and then you get really stiff neck. It sounds like the injury you've had is a bit similar like that with the jerking with the dog. So we could use an anti-inflammatory and that would help bring down some of the pain and some of the tightness a little bit. And then the other thing is, what do you think about seeing a physiotherapist? Is that something you'd be interested in doing?
Yeah, I'll have to do.
There's a drop-in physio here on a Wednesday lunchtime. You can just come in and see, and they'll give you like a one-off kind of work over and give you some exercises. There's your prescription. Okay then.
Cheers.
Take care now, yeah. All the best. You're all right with that. Take care now.
Thank you. See you later. Bye.
Bye now.
Bye-bye.
Come in. Hiya.
Good morning.
Raymond, come on back. How's things going?
All right as such. The rolling pains have gone, but I've still got bad stomach ache. I noticed about a month ago when I went to the toilet to poo,
Yeah.
the water was turning an orangey colour. And yesterday when I went,
Yeah.
there were some streaks. I don't know if it's blood or not.
Right, okay. And are you going to, when you go to the toilet, are you going more often, or is it just once a
No,
day?
it's
normal?
twice a day. I usually
Once
go
or twice?
twice a day, and
Okay.
usually first thing. in
And
the
how's your
morning.
weight doing?
All right, as far as I know.
You
I don't think I've
You don't
lost
think
any.
you've lost any
No.
weight or anything?
No.
And we've got your blood due today, haven't we?
Yeah, I am had chance.
I know
to
it
be
don't
able-
matter, so-
With work, I am had chance.
Well, I think the
go.
fact that you think you've probably had some blood, I need to examine your bottom end, if that's okay.
Right. Yeah, no problem.
And then that changes the position a little bit. We might end up referring you for further investigations.
Okay.
So do you mind if I do the bottom
No,
end? That's great. So if you just have a lie back on there for me.
I'd not thought anything about it. I just thought it was me poo turning water.
Yeah.
It's not clots of blood or anything like that. It was just with me noticing it being streaky yesterday.
Yeah. So what you'd need to do is probably just undo your trousers and your underpants and then turn over onto your left side and lift your knees up to your chest. Is that okay?
Yeah, that's no problem.
Great. I'll just get some gloves on. You had this done before?
No.
Looking forward to it? Nobody's ever said yes yet.
No.
There you go.
With a cough.
Yeah.
Did you say she's got a cough?
Choking.
Oh, Jesus. Oh, ow.
Hello, sorry about that. You broke up a little bit. Can I help?
Great stuff, that's us finished. Just hang on a second, I'll get out of your way. I think the fact that you've got this ongoing grumbling abdominal pain and the fact that you've noticed probably some blood, we ought to refer you on for bowel investigations.
All right.
Because that means having a look at the bowel all the way around, up from the bottom end.
Right.
And what we're thinking about is making sure there's no polyps. So these are little growths in the lining of the bowel that can bleed.
All right.
And sometimes those polyps can be early signs of cancer in the bowel.
Yeah.
And that's the thing we want to be picking up and making sure that we're not missing. So even though it may well all come back all normal, I think it's the right thing to get on and get those investigations done. Is that all right with you?
That's fine, yeah.
Right, we'll make arrangements for that to happen. What they'll generally do is a colonoscopy examination right round the bowel, make sure it all looks clear.
Okay then.
All right.
Thank you very much, and thank you for
nice
your time.
to see you again. No, don't worry,
Thank you.
Raymond, thanks. Well, I'll just walk you down to get your bloods because Jess is waiting for you.
All
We
right.
can get you sorted out in one go, can't we?
Yeah, sorry.
Yeah, you follow me.
Sorry about that. I had to go and review a patient next door. Absolutely fine. Right, so I'm Dr. Khan. How can I help?
What it is, I can't walk on my heel on my right foot.
All right, yeah.
Don't know what I've done. So I thought, I'll leave it a couple of weeks, I'll take some anti-inflammatories, get it down, and it hasn't gone.
Yeah.
I've had ice on it, everything, nice baths, no one's
working.
taking it now.
Let's take a look. So show me where you get the pain.
Just right in that, just in that full area there. So every time you touch it, alert.
Yeah. And just remind me what you do for work. You say
I'm a drainage operative.
Are you on your feet a lot?
All day.
Yeah.
All day long.
Okay. So I think you've got a condition called plantar fasciitis. Have you ever heard of that before?
No, never.
Right. So let me just show you what I mean. So this is the plantar fascia, that lining of tissue that runs under your foot.
Yeah.
And that's the bit that can become inflamed.
That's what's hurting me.
Yeah, yeah. And you can see it's exactly the place where you're getting the pain, really. So you've done the anti-inflammatories and the resting side of things. The next step is really trying to get that more elastic again by doing some exercises, which I'll show you. If the exercises with the painkillers don't work, the other option is then to think about injecting it with a cortisone to try and loosen it up, which is a really powerful anti-inflammatory.
Okay.
So you can see these pictures here.
Yep.
We have to stretch it out really. So you lie down with a cloth, lie on the floor, and you pull your toes back.
Pull your toes towards you.
Because what that plantar fascia links into is the tendon at the back of the heel as well. So, say this is the foot that's the problem.
Yes.
And you pull in there, and what you feel is a stretch all along there.
So
and
basically all you're doing is stretching your calf muscles.
yeah, because you want to
straight.
pull it up really.
So that, yeah, okay.
The other thing is this. This is a really good one, but you use a tennis ball rather than a rolling pin.
Yeah.
And you just roll your foot back and forth over a tennis ball. And if there's any
Like a
inflammation-
massage?
Yeah. The thickened bit will start to break up and then soften. So I'll just print this off for you.
Brilliant.
It's a really common condition, so don't worry about
I
it,
won't
and
worry
it's
then.
easily treated.
Right, thank you very
All
much,
right.
sir. Yeah,
Okay,
cheers.
thanks for
Ta,
coming in.
thank you.
Cheers. Take care.
Janet thinks I've lost a pound. And today I've been trying this week, really.
That's good then.
That's all right, isn't it?
When you've lost a pound and you've been really good, you're like, a pound.
Yeah.
But then when you might been that good, you're like, a pound. Like it's never acceptable.
I remember I went and I'm like, I've had a really bad week and I'd lost £6. I'm like, has your scales got problems?
Wow. That's never happened to me.
I have no idea what were going on. How did I do that?
How have you been? Good. Come and take a seat. Last time we weighed you was November 2017. You were 13.10. You're now 12.11. So
Wow.
stone off. Is it anything to do with cake?
Yes, I have stopped baking.
So you've had all your bloods done for your diabetes?
Yep.
How do you think you've done?
Well,
Okay.
because I'm very careful.
Okay. Your sugar now.
Pre-diabetic.
Yes. 39.
Nice.
Yeah. Cholesterol 2.5. Excellent. Kidneys excellent.
Good.
You're getting a gold star.
Woohoo!
Right, you're on a lot of tablets, aren't you? Losartan for your blood pressure. Lansoprazole for your stomach. Bisoprol. Amitriptyline. Yeah. Sitagliptin for your sugar. Olive oil for your ears. Pregabalin.
For the pain, joints.
Yeah. Laxido.
Yep.
Constipation. You've got inhaler. Fibrogel. Ibuprofen. Manivec. Torvastatin for your cholesterol. Mebeverine for your tummy. Mood tablets.
Yes.
Okay, so we might need to take a tablet out. I'm just doing yours now. Please stop glimepiride 2 milligrams as hypo risk. And excellent diabetes control.
Ooh, I'm going to go eat all the ice cream I can find. No, I'm kidding.
Did they ask you to bring a urine sample?
No, I keep forgetting also.
Okay. If I give you a bottle and a form, will you be able to do it?
Yeah, I'll be able to bring it back.
All you need to do,
just put it.
Leave them in there, put your urine in there, drop it back at surgery.
you.
Oh, it's lovely to see you.
Yes, and
Everything's
tell your
really
boy
good.
Happy birthday for
I
me.
will
The
do.
best people are born on our birthday.
So let's see you before your birthday, yeah?
Okay.
Kidology.
Next year.
Yes.
Wow, a whole year.
Yeah, a whole year. If you find that sugar starts to creep up, come back sooner.
Yeah.
But I think you're going to be fine.
You look after my
And you.
for me.
See you later.
Yes.
I'm going to Bye. Go that way.
Oh, okay.
Bye.
Bye-bye.
Let me get the door for you. Bye-bye.
Cheers, mate.
Take care. Bye.
It's nice meeting you, love.
Nice
and
meeting you too, honey.
Have a good life. Stay as you are. Thank you.
You too.